respected dignitaries, chief guest, guest of honors, special guests, awardees, friends, family, and our dear audience. On this beautiful note of Sarve Bhavantu Sukhina, Sarve Santu Niramaya, I welcome you all to begin the celebrations for the 75th birth anniversary of R.S. Gadgil, the revolutionary healthcare legend. On this auspicious occasion of the 75th birth anniversary of my father, and coincidentally also Father's Day, let me take the opportunity and pride in introducing you to the legend of R.S. Gadgil. His 4 decades of journey in healthcare started right from penicillin at Hindustan Antibiotics. With the towering success at USV, Alchem, Aristo, he became the revolutionary marketing guru of the Indian pharmaceutical industry. His magnanimity and the live life king size is very well known. Brilliance, excellence, wisdom were words he exemplified. With deep thirst for knowledge of medicine and love for education, he pioneered continuing medical education in the country and empowered various associations like API, IMA, MAP, ICC, CSI, RSSDI, ASI, IOA, Traumacon, YROC, and list is actually very long. And of course, also the doctors. Fostering relationships with love and care, he earned the most precious wealth of friends, colleagues, and extended family like you all from all over the world. He always had a special place in the heart for medical fraternity, and the medical practitioners too showered him with immense love and respect, and he was held in high esteem amongst the 3 generations of doctors. For the leader that he was, he mentored, trained, taught many, nurturing his team, his marketing team, training his sales team, and teaching science and MBA to students for years. He wanted he wanted his students, his followers to develop themselves, rise and succeed. Having enormous passion for branding and profound knowledge of science and marketing, he created several top brands, Monocells, Flexon, Glycomet, EcoSprint. These are really household names, and the list is also endless. 20th and 21st of June, as we celebrate his 75th birth anniversary, he continues to be our guiding star even after 7 years of his loss. The deep pain of his loss, yet memories full of happiness, drive us every moment towards his deep purpose of reducing disease burden and achieving health and happiness. Allow me to share a short video in just a little bit to know a little bit more about him. R.S. Gadgil's strong purpose of developing effective therapies to reduce disease burden and profound vision of true nutrition true nutrition for true wellness for generations to come is being taken forward by me, his daughter Rajeshri Gadgil, CEO and founder of True Wealth Integrative Healthcare, RSG Nutrition Private Limited, and Medinex with 20 plus years of global experience in nutrition, continuing medical education in therapy areas like arthritis, digestive diseases, diabetes disorders. The list is long, but I don't want to really emphasize too much on it. Having worked in New York with most respected companies there, True Wealth Integrative Health TV is my initiative to spread authentic knowledge, expertise, and experience of healthcare stalwarts all around the globe and especially in India. True Wealth Integrative Health TV has done more than 250 plus patient education programs and CMEs with more than 1,000 healthcare stalwarts in the past pandemic year. TrueWealth provides integrative health and personalized nutrition advice to control, prevent, and reverse lifestyle, autoimmune, as well as infectious diseases to help reach the ultimate goal of holistic health and happiness. With, of course, our integrative health and nutrition clinics, which we run with our international trained and experienced healthcare experts in several areas, with also our integrative website, which lets patients reach out to us when online through this pandemic and also offline. Last but not the least, ENERGYA, which is a division of RSG Nutrition and Healthcare, makes responsible evidence based nutrition formulations targeting specific indications so that people we will be actually able to control and prevent diseases. With that, allow me to share a short video on R.S. Gadgil, really the legend of our healthcare industry. I hope that movie let people know about uh, RS Gadgil really, and also I'm sure a lot of people are getting goosebumps looking at those photos. Um, I would now, of course, want to get our chief guest to speak with us, but just a minute before that, I would want to talk about the concept of really wisdom and excellence, which R.S. Gadgil really wanted to take forth. Pillars of wisdom, of course, of humility, integrity, stewardship, discipline, courage, passion, perseverance, and much more. Wisdom Forum aims to collect, decipher, and propagate the wisdom and excellence of legendary medical practitioners, leaders, and teachers from around the globe to enable the forthcoming generations to gain the in depth expertise and experience to further excel and provide exclusive service to mankind in reducing disease burden and taking the wisdom and excellence legacy forward. With that, I of course want to uh, give you the introduction of today's chief guest, and we are absolutely honored to have Honorary Shri Vishwajit Pratap Singh Rane with us. And sir, it's immense pleasure to have you here. Allow me and give me the privilege to introduce you. Shri Vishwajit Rane ji has held cabinet positions for more than a decade, since 2010, and represents the Bharatiya Janata Party. He was the Minister of Health, Agriculture and Crafts and Training in the government of Goa from June 2007 to March 2012. March 2017, he was sworn in as cabinet minister in the cabinet led by late Honorable Manohar Parrikarji, and to date he holds portfolios of health, craftsmen, training, and women and child development. Today being Father's Day, a special mention that he's the son of Honorable Pratap Singh Raoji Rane, who has been former Chief Minister of Goa not one time but multiple times. After receiving his Bachelor's of Commerce degree, he has also done his management. And being a Goan, of course, he has his love for sports and has represented Goa in badminton. He's been ex-chairman of the Goa Tourism and Development Corporation, a member of the Tripura Committee, president and founder of the Satari Yuva Morcha, and has globetrotted across Germany, Egypt, Turkey, Malaysia, Japan, China, Australia, Italy. The list is really, really endless. But on that great note and the precise, if you can unpin, we would actually want to have uh, Honorable Vishwajit Raneji on the virtual stage.
I can start. Rajesh, can I start?
Yes. Yes, absolutely. And we're really waiting to hear from you, sir, because you've been into the healthcare field more than a lot of us, and you are going to share a lot of your insights with us. So we're really looking forward to it, sir.
Rajesh, at the outset, I would like to thank you for having me. All the members of the panel who are much, much senior to me and with vast experience. And I am, I think, the youngest in this whole panel. Apart from being a position that I hold, I would like to pay my respects on the occasion of Gadgil Sahib's 75th birth anniversary. I know it's a very emotional moment for you also, because today being Father's Day, and what you showcased today was his passion, the energy that he had. I was just watching the film, the energy that he had, and all that has been said about him, all that you have put through the slideshows, and his knowledge and what all he did for the industry. I think that is what we are here today, because of the type of respect that he holds in this whole industry and what he tried to do. I am privileged and honored to be a part of this today's function on the occasion of Gadgil Sahib's 75th birth anniversary, and also for as a chief guest for the Wisdom and Excellence Awards, which are in the name of Gadgil Sahib. And all what I wanted to say, like I mentioned to you yesterday, we have been also talking, and this has been a very big learning process for us here in the state of Goa. All the experts who are there on the panel, I would like to share with them is that it's very important, this excellence and wisdom awards, and encouraging people to come forward and do things. We have all gone through this pandemic. We have all gone through the pandemic, and even in the state of Goa, we have had one of the worst periods in the last 1 month, which has taught us so much. But all through the pandemic one, and apart from what Goa has been doing, we have had excellent infrastructure. Luckily, I was a health minister earlier also during my tenure from 2007 till date. Then I'm also holding the portfolio of the industries. This is it gives you a different outlook to what was required in the state of Goa. In the state of Goa, when I took over, we didn't have proper PHCs, CHCs, but our PHCs, CHCs, primary health centers, and our outreach programs, I think maybe one of the finest in the countries. Today, we are very open to ideas. And like I shared with you yesterday, that we are open to the people on the panel, all the experts on the panel to even make suggestions. Today, it's not only is giving you an inaugural speech for such an important program, but it's also about how one and every state government needs to look at things. Many times we take it very easy, we don't give that much importance to healthcare that needs to be given. But in Goa, fortunately, I must share with you because I was reading in 2017, Dr. Ashok Johari was also felicitated by your thing. Ashok Johari, my daughter was born, he was a patient of Dr. Johari. So that's when my passion for healthcare also improved. I'm also very passionate about healthcare. I hold the portfolio. I fight for this portfolio every time I come into power because I want to do something different for the patients. I want to see that they don't have to spend money, but the state takes care of them, and even preventive medicine and also future costs to states can be reduced. Today in Goa, we have got the finest district hospitals, finest healthcare. So today we have got the largest hospital built by the Prime Minister's fund, which I pursued, and we have got a 450 crore hospital, which we want to, like I mentioned to you, that we want to tap it, top people like Dr. Amit Mahadev and others to come and not only share the education, but also have that type of a model where we have various specialties within the state of Goa, and people from the state of Goa don't have to go out. This pandemic only taught us that we have to have more oxygenated beds, and all this is generally what has been talked about. All the people on the panel know about it, but also skilling, because that's one of my portfolios. We found that we had no people to deal with this pandemic. We didn't have people going into these wards. As a result of which, we had to stress and tied up with organizations such as Portia and several other organizations to help us, give us knowledge as to how we can use community skilling and basically create more jobs of health assistance and other jobs. Healthcare sector is one thing which has surprised the whole world. It's a tremendous opportunity that the healthcare sector has. Number of jobs that can be created which are not there today. Government of Germany wrote to the government of India that we want health assistance if we can export health assistance. I look at every job here as a commodity. I look at every human as a commodity which can be exported, because job cannot be restricted only to your state, but even outside your state. Goa, we have tied up with companies like Novo Nordisk, their education foundation, the research foundation that they have got. We have tried to deal with diabetes registry. Goa was the first state in the country to have a diabetes registry. And Goa is only the state where we give free insulin to all and different categories. We spend so much of money because we find that if we are able to detect and not only just give insulin for the sake of giving insulin, but also how can we reduce the dosage of insulin. And for that, proper monitoring is required. We have put these monitoring mechanisms in place. Children with hemiplegia and other problems, how to deal with them, those centers have been set up. Ultimately, on a wide spectrum, we have been dealing with situations in Goa. We have got one of the finest PHCs, rural medical dispensaries. Even you could digitize the platform so that we are able to, like I mentioned to you, we have digitized to a great extent about people who have different type of comorbidities in the villages and other areas, so that we could deal with them if they got COVID. How to move them into the centers if they've got comorbidity. So this taught us a lot. Actually, it being the health minister, got an opportunity to deal with this, firsthand and understand and took advice from experts. My own parents in January when they got COVID, my father is 83, mother is 75. And ultimately they told us how do we deal with the protocol. And I was shocked that in my hospital that they were not doing IL-6 and D-dimer tests. I said, labs are very important. I said, how are you going to do the craft? How are you going to overcome the cytokine storm? I said, what is going on here? I said, we are not here. And Goa is the only place, Ajishi, and I would like the panelists to know that we have been giving free medications at all levels. We have been spending lakhs of rupees. We as a small state have a budget only for free medications for OPD and in-house patients of over 150 crores. And we have been giving remdesivir, tocilizumab, and everything that is possible free of charge to the patients. I mentioned to you that I will also touch on a controversial subject of WHO and ICMR. I don't believe either. I believe that the doctors and experts in our country are capable enough to take decisions on first hand on what they get experience from what protocols they follow. Why should I follow ICMR or why should I follow WHO every time who goes on changing their protocol? Every time we find that they go on changing, remdesivir is not good, something is not good. Then what is good? How do you deal with the patient? If we have got very good results for a particular patient, if plasma helped at a particular time in a combination with steroids and remdesivir and whatever cocktail they were using, then we used that at that point of time. There was nothing else. Then one fine day somebody comes and says, drop ivermectin. So ivermectin becomes a very big controversy. There are doctors, we had a VC with doctors from Florida and all. I asked my doctors, talk to them. Though we dropped ivermectin ultimately, that please speak to them. Please talk to them. It's not necessary that you should continue to use ivermectin. But ivermectin for COVID patients. We used to have isolation kit we used to distribute in every house. And we had a fantastic way of managing this. But you know what happens? Sometimes our doctors within the state and within the country have sufficient expertise with first hand as for what is the protocol that they're using. Overall guidance can be given to us, but if something is working, you may as well use it. Like a doctor said, first is your priority is to save the life of the patient and then deal with other things what are to be dealt with. And ultimately the same thing. I have been fighting with ICMR as a health minister. I said, every time you go on changing the protocol, I said, do you know the cost it costs to the state? I said, if we procure so many medicines and so many things, how do you expect us to move forward? I said, I am not going to listen to you. We will continue through our group of experts as to what we want to do. Ultimately, they should be convinced. My main thing is, my conscience tells me that my job as a minister is to facilitate the experts to implement what they feel fit to save the patient's life. I think all the doctors in the panel, it is okay, though I am a minister and my government in Delhi is the same government in the center. Sometimes I have become very controversial when I make these statements on WHO and other things. But then sometimes one has to see what is required. I mean, everything what they say is not something that I'm going to go to listen to, because we also have got doctors. We also have got experts in our own country. We also have got doctors who can suggest, no, this was to be done. Like a friend of mine came from New York. He said, my doctor told me, though it's not recommended by CDC, you take ivermectin. I am telling you to take ivermectin. It will help you. So I basically, when the infectivity rate reached 51%, I had to resort to various things, but that also with the advice of experts. So I don't want to take much of your time, but I want to share with you that Dr. Ashok Johri, my passion for health started when my daughter was born premature at the 26th week, as a result of which she had to undergo serious treatment under Dr. Johri for a large number of years. And today she's perfectly fine and she's studying in America. So going to these hospitals, interacting with patients, and nobody knew. I was no minister, I was nobody at that point of time. But interacting with patients, sitting down like a normal person and understanding what is the trauma and what is the problem people face, helped me understand the health system and what needs to be tweaked in the health system to see that people are not going through what I went through at that point of time. And I can only say on this occasion, there is lots to be said. We have created so much of infrastructure in the state of Goa. We are now putting up, commissioning our new hospitals. We are doing several things and trying to get as many Goan doctors who are outside. Even Dr. Karapurkar, who is specialized in aneurysm and other things in Beach Candy, who is originally a Goan, is also helping us take some of the students he has trained so that we are able to deal with aneurysm and focus treatment on focus things, because everything if you want to do, it's not going to happen. Like Dr. Amit Maidev's advice, start a gastro center in Goa Medical College. So we have been doing so. This not only creates the exposure and avenues, and it's not only having the knowledge, is how we are best in a position to utilize the knowledge and utilize it to save people's life. Goa government has tied up with Yale University of Global Health also. We have a MOU then for knowledge sending our teachers and our professors there. University of Miami for treating of patients beyond the golden period, for treating of strokes. Several things I have done during this period. And my connection with you. I call you, I religiously follow what you tell me. And that's how life takes us to different forums. My journey started 22 years back and the passion for health. I am very happy to be here amongst all the experts, all the seniors who are here today. And like I told you that if there's anything that you can share with us, if anything that we can do, we would be happy to do, because this pandemic, I don't think, is going away so fast. Everybody is talking of third wave. Nobody knows how the third wave. Nobody knows what kind of infectivity rate it will be there. Will be there. What is the type of oxygen consumption will be there in the third wave? Nobody knows. In the second wave, we were all taken by we were all in a state of, virtually we were in a terrible state. And let me share with you that I'm sharing with you on this, that yes, a lot of people died because of lack of oxygen. What could I do? At that point of time, we had to somehow struggle and somehow see that whatever resources were there, we had to rationalize it to see that we save every life. Being a government hospital, I cannot say no to any patient. I have to give patients treatment everywhere. But then there is always something called the media that always likes to exploit on a situation that exists. But my problem is that I have to give treatment to every patient. But today the situation in Goa is much better. We learned from what we went through, and we are in a much better position to deal with any kind of situation in future. And if anybody on the panel would like to suggest or would like to give us guidance, the state government is always open to accept. Like I mentioned to you, you mentioned yesterday, the doctors, if you can put me in touch with them, then I would be happy to invite them to go up and try to improve ourselves and see where we can correct ourselves. Ultimately, as a health minister, my job is to take the advice of experts and try to see. But sometimes, as a health minister, I like to put a strong view after listening to the experts. And I must be one of the only, because there are a lot of ministers in this country who get scared to make statements on WHO or whether it is ICMR. I have fought all of them. Controversy is not the thing. Your conscience should be very clear that your service to society and humanity and saving lives is the only thing that you must do. On the occasion, on this very special occasion, Rajeshri, on Gadgil Sahib's 75th birth anniversary, where the award ceremony which you have initiated, I wish you all the best, and thank you for having me on the show. Thank you so much.
We are really not just honored, but like you said, excellence plus emotions is what has really happened right now. So I would just like to say a few things based on all that you've said, and it is amazing learning experience in just few minutes for us. All I have said to you, and we promise that we will try to do our best to contribute to actually increasing the infrastructure, helping train more doctors, nurses, and support staff. And TRUWELLTH is trying to do attempts in that direction. As I had mentioned to you, for RS Gadgil, Goa is like a second home, and medical conferences destination is what he passionately made Goa in early 90s. And I'm sure with you we will reach a new paradigm in health, and we're really looking forward to it. The names you took, two names, Dr. Ashok Johri and Dr. Amit Maidev, these are names which they speak for excellence, wisdom. They are beyond it. I really call them gods. And absolutely, Dr. Ashok Johri is absolutely a great person. He's father of pediatric orthopedics in this country. And we, of course, share a great bond with him. But on that note, maybe utilizing digital in medical training, and I'm talking about this right now because we have a lot of doctors here. So if we can actually utilize digital for medical training, not just of the support staff, but also if we could look at a model where more doctors could actually be trained online and physically, of course, then there'll be less load on the infrastructure. If we could try to do these things, we are open to putting all our efforts to it. But on that note, I know this is not scheduled in the agenda, but I would actually request Dr. Shiv Kumar Oture to say a few words. Of course, a lot actually was said by Honorable Shri Vishwajit Raneji. So, sir, I know I will quickly give an introduction of you, and if you can say a few words, that will be really great. Dr. Shiv Kumar S. Uture, of course, he is the member of the National Medical Commission. He is the president of the Maharashtra Medical Council, member of Medical Advisory Council, practicing general surgeon and laparoscopic surgeon in Mumbai. He is the director of the North Bombay Clinic, Mumbai, and is attached to Fortis and Shushrusha Hospital in Mumbai. He is MS in Mumbai University from the Mumbai University FICS, FMAS, and he's professor of surgery and unit head at the Grand Medical College, JJ Hospital. He is fellow of the International College of Surgeons, fellow of Minimum Access Surgeons. He is undergraduate and postgraduate teacher, really respected and examiner of the MUHS since last 35 years. He's recipient of the BBMG Mahatma Gandhi Award at the British Parliament, London. He has received the Best President's Award for IMA Maharashtra and National IMA Delhi headquarter in the year 2010-11. He has received President's Appreciation Award for Self-Service for IMA headquarters Delhi and IMA Maharashtra for past 6 years. And he has been invited to deliver multiple orations and lectures in different medical organizations. We know the amount of relentless work Sir has been doing through this pandemic, talking, educating, and much more. So, sir, if you would, I know your speech is scheduled a little bit later, but if you would like to make a few comments before we get on to the program.
Yeah, thank you, Rajeshri, and respected chief guest, Mr. Raneji, and all my colleagues whom I find my seniors, my colleagues, whoever are there in this panel. I'll be very short. I think what I will basically like to talk about is my relation with Gadgil sir. You know, almost decades back when we met, at that time, of course, I was age-wise much junior to him, but he always treated us as his colleagues. And, that was the way he worked, where the who's who of medical fraternity, he was on the first name basis with all of them. And because of that, he could, may it be a senior person, junior person, whatever it is, his relation was completely different. It was not that of a, pharmaceutical giant and the medical fraternity, but as friends that he was. Two things I would mention about this personality: a very towering personality. We could feel him before he would enter the room also. That was his personality. And there are two things especially which are also very close to my heart, which I would like to talk about him. Almost 3 to 4 decades back, this person pioneered what is called as branding of the pharmaceutical products. And today, all these MBA people and everybody are taught about this branding in today's era in their curriculum, which he has been doing it right from almost 4 decades back. And second thing, of course, which is very, very close to my heart, especially because I'm in the council, is regarding CMEs. I think he was one of the first ones to tie up with the medical organizations to bring in the CMEs to all the doctors. And the importance of CMEs, especially during this COVID era, is something that we have experienced. And using technology along with CME, I think we have been able to disseminate the information of this dreaded disease, which was a new disease for everybody. We had never heard of it, never learned about it. It was never taught in our curriculum ever. But we could disseminate all this information through these CMEs, and I think we have to grant it to all the medical fraternity. I'm talking about all over India, that they picked up on all these nuances of how to treat this disease. And therefore, if you see, even if the numbers were very high, and that was purely because our population is so high, if you see the percentage wise, the deaths or maybe even the requirements of ICU and everything has been far, far less even than the highly westernized countries who are way, way ahead of us as far as medical technology is concerned. And that has been possible because we have been disseminating this information. And I think I must grant it to Gadgil sir also of being one of the first ones to understand this concept and tying up with the organizations. He was on the forefront in all our organizations, and he never said no whenever we said, sir, we want to hold a conference or we want to hold a CME. As you know, the finances becomes a big aspect of holding such events. and he was always there to help us out. And I must congratulate you also, when you phoned me up and told me that this was on the occasion of the 75th birth anniversary of Gadgil sir. Of course, I could never say no, though I know in the past you have called me, and because of my schedule, I could not attend quite a few of your programs. But today I made it a point to be free and definitely attend this program. And I must congratulate you also for, you have kept his legacy alive, and you have also been promoting, just like him, the wellness and targeting the lifestyle diseases in all your products. We have learned during this pandemic, it is not the medicines or anything, but it is your pure immunity which is going to help you fight this disease. And that is, I think, it is not now, but you have been doing that for past almost 10 years. You have been doing that, trying to promote this aspect of the pharmaceutical industry amongst all the doctors and of course the patients. And of course, I would take this opportunity to also congratulate you on another legacy, just like how he won a lot of awards. I think you have received the Brand India Woman in Business Award 2021. So congratulations from all of us to you for that also. And being in the council and being on the forefront and an activist of IMA, since Rane Sahib is over there, I would just, and he asked us that what would be, he would like to hear from us. One thing I would like to tell you, sir, is that the doctors have, especially during this whole 1.5 year, have been on the forefront. We are almost like the soldiers on the borderline against this pandemic. And we have been working without knowing how to work. When I say that, because this was a new disease, we were also learning on the ground how to treat this disease, how to manage these patients. And there are, of course, I agree, when something new comes in, a lot of mistakes are done. We learn from our mistakes, but that is how life is and that is how medicine is. So, but we, the medical fraternity, since you are the health minister, also require a protection, because I see a lot of medical legal cases which are there. And I am finding that, the first 1.5 year was okay, but in recent times, there are a lot of medical legal cases which are put by the patients on the doctors. And what they say is that you have treated 3 months back my relative in such a way. But the protocol today says that, just like how you said, don't use ivermectin, don't use remdesivir. Protocols are changing every, I would say, weekly or fortnightly. And that becomes a very big problem for our medical fraternity. We have done it in Maharashtra as the council president. We have passed protocol as far as treatment is concerned, and we have passed it in the council unanimously that if a doctor treats a patient in good faith, according to whatever the treatment was there during that period, I think there should not be any medical legal case which be filed against us. Sir, if you give us this protection, in Goa, so if you give them to all our doctors over there, definitely they would be able to fight this pandemic much, much better, especially when they're expecting the third wave to come within a few weeks or months. And the prediction is that the death rates would be much, much more than what we have seen in the second phase. So that would, that would strengthen us to boldly fight this infection. And as you rightly said, it is the clinical acumen of doctors on the ground who have seen this disease and treated this disease to decide on how to treat this disease, instead of depending on someone sitting in those air conditioned offices and trying to dictate to us how to manage our patients. I think that is one point which you have put forward, which really we appreciate as a person, as a health minister. And I think if that is followed all over India, we will be treating our patients much better. Having said this, I think I thank you very much, Rajeshri, and it was my privilege to be there today for this and for this session, and definitely fond memories of Gadgil sir I have from the past, and I assure you we will continue the same relationship. Thank you very much.
Absolutely, the love and the fight for health will continue with you, sir. And thank you very much for all those kind words for my father, of course, whom you really shared a very close relationship with. But on that note, I would like to now really present the token of our appreciation to the Honorable Health Minister, Dr. Rane. I'm calling him doctor because he's absolutely, that's what he is been doing for quite some months now. So Honorable Shri Vishwajit Pratap Singh Rane ji, we present this to you. Okay, it's not been seen. Okay, been seen, right? That's a token of our appreciation, and of course, we will physically present you a trophy soon down, just in a week's time, and in the presence of course, Dr. Oture and several other dignitaries that we have here. Can we have it for some more time? It's gone. Yeah. Continue. I want to read it now. No? Okay. Keep it there for a few minutes. That's the award here from our end. So please accept it virtually, of course, right now.
Thank you so much, Rajesh. Thank you so much. Thank you.
And of course, in your hands, if we could also present our token of appreciation also for Dr. Uture. Of course, bear with us technically. Takes a little longer. Well, again, honor, sir, to have you with us, Dr. Shivkumar Oture, and for the great work you have been relentlessly doing for years. This appreciation is absolutely nothing, honestly.
Thank you.
We would request the chief guest and of course the guest of honors to be here with us. But of course, Rade sir, we understand there's paucity of time, but whatever time you can be with us, it will be a pleasure. We would now move on to the program, of course, which is scheduled for today. And really, I want to also talk about our another special guest who is with us, Dr. Rekha Bhatkande. Dr. Rekha Bhatkande is a gastroenterologist practicing for more than 40 years. She has been dean of the Sushrusha Citizens Cooperative Hospital. She's president of the Family Welfare Agency at NGO since 1950, working for poor elders, president and co-founder of the Dilasa Group of Senior Citizens for last 10 years, honorary secretary of Multiple Sclerosis Society of India, received the Baibi Chawan Pratishthan Award in 2017. She's felicitated by the Ministry for of Social Justice and Family Welfare, Maharashtra State, and she started the Mumbai's first all-women clinic, Sakhi, with aim to provide women a space where they could deal with their health concerns without inhibitions. She's a great lady. I have absolutely great regards for ma'am. Thank you so much for being with us today. And on that note, we would begin our RSG Wisdom and Excellence Award ceremony on, of course, the 75th birth anniversary of RS Gadgil. And I take pride in announcing the RSG Excellence Award in Patient Care to the Sahyadri Hospitals. It is the largest chain of hospitals in Maharashtra. The group has 8 hospitals with more than 900 beds and 200 ICU beds with more than 2,000 clinicians, along with 2,600 plus support staff. Sahyadri Hospitals has touched the lives of more than 50 lakh people by providing quality care. Sahyadri Hospitals are easy to reach due to their strategic location in the cities of Pune, Nashik, and Karad. And it is the brainchild of Dr. Charudat Apte, one of India's most renowned neurosurgeons, and more importantly, an ardent practitioner of ethical medical practices. It was his philosophy to make quality healthcare available, accessible, and accountable, and not restrict as a privileged few, which still stands as the group's pivotal touchstone. Today, we are fortunate to have Dr. Ketan Apte with us, who is ably managing the operations and will be receiving the award on behalf of the group. Dr. Ketan Apte, such a pleasure to have you with us today. But of course, your introduction won't be complete until we have Dr. Ashish Arbat, who's a special guest with us, and he can actually introduce your hospitals and you much better. So I would like to welcome Dr. Ashish Arbat. He's one of the first 3D robotics joint replacement surgeons in Western India. He's consultant orthopedic surgeon, of course, at Sahyadri Hospital at the Jahangir Hospital, Pune. He also practices at several hospitals in Mumbai, Thane, and Kalyani areas, and he is MS Ortho and MCH from the Royal College of Surgeons, and he has a fellowship from the Princeton University, New Jersey, and under, of course, Dr. Jeff Abrams, and he's the first Indian fellow under Dr. Ed Sugaya in shoulder and elbow arthroscopy. Dr. Ashish Herbert, welcome, and I would request you to do the honor of introducing the Sahyadri hospitals and, of course, Dr. Ketan Apte.
Hi, Rajeshri. And happy Father's Day to both our fathers who are not there and who are the fathers here. I did not know RS Gadgil, but I definitely know RR Gadgil, who is carrying on the legacy of her father. And all the best for this RSG Wisdom Forum. And every year I've been a part of it. And this time there was a panel meet to discuss whom to give the award. And the first name that comes to my mind is Sahyadri Hospital, because I've been a part of it. I've been privileged to meet the legendary Apte sir. And to talk about Dr. Ketan, I would call him the Hrithik Roshan of medical industry for India. He's the future. I'm not flattering, but he has, why I'm calling him Hrithik Roshan is he's come from not having only the privilege, but he has walked from the grassroots. And I know how much hard work Ketan has put to come wherever he is. What happens to live up to such a big father's legacy? It is difficult and very overwhelming. But I am really proud of you, Ketan, what you are today. Your level-headedness, and I am so astonished when I saw him for the first time, because I was been called. There were a lot of meets with his colleagues, but that Apte sir wants to meet you once. And when I met him, I had a big aura. Some prince is going to meet me, and I was well dressed, and I just went to meet, and we are very good friends now. We meet on coffee now, and this is Ketan Apte sitting very peacefully, no aura about him, no ego, and I'm really proud of it. He has taken Sahyadri to unmatched levels, and believe me, in coming time, I would see Ketan as sitting on the international platform representing India also. Relentlessly, this man, you call him at 3 a.m. in the morning, you call him, he is always there, and there are very few words to talk about him. His work and his grassroots, and today he's heading the business. Ketan, I hope I can call you Ketan now, but you're Dr. Ketan Apte. I'm very, very proud of you, and you deserve this award. And your group, including my father's treatment, my complete family was treated by Sahyadri Group of Hospitals. Sadly, we couldn't save my father, but he has saved n number of my friends. Thanks, Ketan. Thanks for the beautiful infrastructure you have in Deccan and other places. And over to you, Rajeshri. I think he is a role model for most of the new MBAs who are joining. They should learn the humility from Dr. Ketan Apte. Very, very proud of you.
Thank you.
So
Thank you.
you rightly described him as Hrithik Roshan for several reasons, and the relentless work that he has been doing on the ground is, I'm sure, it has been a huge learning and what to say, an emotional time for Dr. Ketan Apte as well. We would like you to share with us all that you have been doing through these times, and what we could actually learn from you and your insights. That's really going to inspire a lot of people who are listening into this program today.
Thank you, Rajeshri Madam, and thank you, Ashish, for the kind words. As he mentioned that he's part of our family, but more than that, he's a very close friend of mine. And we are very glad to have doctors like him working in the organization. That's what makes the organization what it is today, the people who are working in the hospitals. So when it comes to COVID, it was a phenomenon which none of us expected to hit. I mean, we never thought of going through a pandemic. But then there are testing times. I still remember March 15th, when the lockdown was first imposed. All the hospitals across the country were in the fix. What to do, how to treat the COVID surge, what protocols to be implemented. But as all the doctors in the IMA, AIMS, MMC, as Uttara mentioned, the protocols started coming out, and there was a sudden surge of patients coming to the hospitals. All the hospitals keep on saying they're equipped to handle patients in isolation, but nobody's equipped to handle so many patients coming at once. As Raj Madam mentioned, we are a hospital with 900 beds spread across 3 cities. We had literally given almost 80 to 90% of all our beds in the first wave for COVID. We had more than 450 to 500 beds occupied with COVID patients. But it was such a new phenomenon. The treatment protocols which were coming out were quite experimental. Patients had no clue. Doctors were trying to struggle and understand how to contain the disease. People did not understand the spread of the disease so well in the beginning, and everyone was in a fix. I especially must admit that the doctors, the nurses, the technicians, people who are at the front line, people like us, we always guide them, we support them, but we are never at the front line. People who treat the patients are the real heroes, and I must admire their courage that knowing that this is a deadly disease which is taking so many lives. Most people who are working in our organization, and not just Sahyadri, across the country, gave their complete efforts without worrying about what's going to happen to them. They had to face the wrath of their families. Societies were trying to reject them because they're working in hospitals. But the medical fraternity across the country has really taken upon itself to ensure that the people of this country are served properly. As I was mentioning that even though most of our beds were occupied, the surge of patients was just too much for everyone to handle. In the first wave, it was an experiment, so the treatment protocols were not set. But the power to reject the patient is such a bad thing to have. Is something which you learned during that time. All the people who have influence in the hospital, who know the top management, you keep on getting 300, 400, 500 calls a day. And you are absolutely starting to refuse a patient which you know that if the patient doesn't get a bed in the next half an hour, 45 minutes, the chance of the patient losing his or her life is very high. But the first wave kind of went on till October. Things started settling down. But we knew as a hospital that the second wave and third was going to come because the Western world was almost 6 to 8 weeks ahead of us. So we started upgrading our infrastructure. We are not expecting the second wave to be as bad as what it was. Even though the protocols were in place, the sudden uptick in cases took all of us by surprise. In the second wave, we literally had more than 700 beds occupied only with COVID. I forgot to mention one thing. The Pune Municipal Corporation did play a very, very vital role during the first wave. Whatever schemes they came out with and the way they handled the overall pandemic was quite admirable. Even though media claims things differently, I must say that when the country with the kind of population we have, we cannot provide bed to everyone. We have to rationalize, we have to ensure that the beds are given to people who absolutely deserve it. The way they came up with the COVID hospital near COP, the way they managed to convince the hospitals to give 80% of their beds for COVID. Yes, I understand the hospitals did crib about it, but as a primary need, we had to ensure that we are able to give as many beds to COVID as possible. We had submitted a 35-bedded hospital of ours complete to PMC. At the same time, we have a hospital in Pune, which is a dedicated hospital for Ayushman Bharat. As a group, we do believe that even though we are a profitable organization, we have to give back to society. So we have literally converted one hospital into an Ayushman Bharat hospital, where we took a lot of patients, treated them free of cost. Same was the case in Nasik and Karad, where we have these schemes running. The second wave was, frankly speaking, a nightmare because the number of cases piling up was even higher than what happened in the first wave. We had upgraded our infrastructure, we had added few beds, hence we could take 100 more patients. But the severity of infection had reached such a peak, and the demand for oxygen was so high that it was literally a nightmare for the supply chain, for the oxygen suppliers to manage it. But luckily, to be very frank, that since we are a big hospital chain and we have so many places, the oxygen providers did prioritize us because we have more patients embedded with us. So was the case in most of the bigger hospitals. But I still remember incidents. A small hospital in front of our branch in Kothur was suffering from a lack of oxygen, and they had almost 10 patients who were on ventilator, and they did not have oxygen for more than 2 hours. They gave us a frantic call. Somehow we had a couple of cylinders left, and we were able to reach them on time. I don't think anyone, I mean, I have few of my colleagues here who are in the similar position as I am. No, none of us ever thought that we'll have a crunch of oxygen. That is such a basic necessity, but the requirement of oxygen literally went up by 4 to 5 times, which actually forced us to start, ordering oxygen plants. So we are putting oxygen plants in almost all of our bigger centers to ensure that if this kind of phenomena repeats, we should not put strain on the supply chain system. I think as a big hospital, all of us have the responsibility to ensure that we are as self-sufficient as possible. So tomorrow, when such a situation arises, the supply chain is able to reach people who cannot afford to put such oxygen cylinders and have such facilities. Again, to fight the third wave, we are increasing hospital capacity again. We are adding around 150 beds across the chain. We are adding around 70 ICU beds to our Pune facilities because the number of oxygen beds or beds which can supply oxygen has increased dramatically in the last 1.5 years. But most of the hospitals lack the expertise to provide ICU care, which is the real need they are. So I look at the entire healthcare infrastructure of our state or our city in 3 tiers. Tertiary care hospitals like us should be focusing more on ICU and critical care patients only, and leave the mild and moderate cases to most of the nursing homes where they can be managed. So our basic focus for third is going to be on extremely high-end treatment. But I do hope as the city and the state unlocks, people behave more responsibly and maintain certain protocols because uh, as the city is unlocking, we are seeing visuals of people gathering at multiple places, not wearing masks. It's a party. And the after party is going to be again a third wave. And as we need to be absolutely careful about this, the new variants are coming in, they are mutating constantly, and they're causing issues across the globe. UK had opened up a couple of weeks back, the cases over there have again started going up, and they're again thinking of going back into lockdown. Japan has been facing problems, Taiwan is facing problems. So, as the doctor aims, Dr. Gadgil said, the third is definitely coming. What we have to ensure from our end is that no hospital in the entire country can provide a bed to every patient. We have to ensure that the caseload is low. We have to ensure that the vaccination programs are ramped up. We are doing more than 3 to 4,000 vaccines a day. We are ready to ramp up to more than 10,000 a day, but the problem right now is supply. And the kind of demand most of these companies are, it is going to be impossible for them to fulfill the demand in such a short period of time. But a vaccination is the only weapon we have against this war. Uh, People need to be more careful, even though the lockdowns are getting over and people are free to roam around. We have to follow social distancing. We have to wear our masks and ensure that we at least protect the others. If you're not careful about yourself, because if the third wave is as bad or worse than what second wave is, as Dr. Uttare was mentioning, that we are expecting more deaths and more severe cases this time. Only God can help us because the entire healthcare system of the entire country is extremely stretched. Pune or Maharashtra at large is fortunate to have a lot of medical hubs. The healthcare infrastructure of Maharashtra is quite robust. But I have my friends in other states, some northern states, where the healthcare infrastructure is quite poor and they are facing huge problems with patients. A lot of patients are not getting reported, the patients are dying at home. Comparatively, we are in a better place. But yet, we still did clock the highest number of cases in the entire country because the testing was quite high. The only way out from this pandemic, if you really ask me, is to ensure that you as an individual protect yourself, at the same time protect your entire community by by behaving in a complete responsible way, and encourage your friends, your family members to undergo vaccination as soon as possible. I would like to thank Rajashri madam for the award, and it's a great honor. And as I mentioned before, that we are preparing again for the third wave. I just hope that our preparations will go in vain, and we won't have to face a third wave in the near future. Thank you, ma'am. Thank you very much.
Wow, it was really great to know about your journey. And like you said, for the first time, being most accessible as a hospital, and the power to say, reject or the admission what you mentioned is it's just unnerving, but
Most
what to say.
terrible feeling one can have. Most terrible feeling.
Yes. So on that note, of course, we want you, of course, to safeguard us and save us, because like you said, the party is still on. So all the efforts that TRUWELLTH is trying to take is relentlessly trying to tell people to not venture out, and take, if you venture out, take all the precautions. But I would like to, of course, have Dr. Ashish with us, but I request Dr. Uture to please do the honor of giving the award to Dr. Ketan Apte. I'm sure what he spoke is just tip of the iceberg. He has been going through much more through all these times, and we absolutely wish you luck and a lot of strength from our end for the coming times.
Thank you, ma'am. Thank you very much.
Sir, Dr. Utre, sir.
Yeah.
This is
Thank you, Rajeshri, and I think I must congratulate Dr. Apte. And just like how the whole Sahyadri group, I think all over, especially in Maharashtra, where I've been continuously in contact, everyone has worked very hard. And I can understand that, up till now we were trained as clinicians, but for the first time you were being made to do something as administrators, which was also very, very difficult. To decide, as you said, one of the most difficult things is to decide which patient to admit, which patient not to admit, which patient to give oxygen, which patient not to give oxygen, the ICU beds. And I think literally, as you know, they used to say in the past, doctors are like gods. We had to act like gods to decide who would live and who would not live. And this has had a very, bad psychological effect even on all our medical fraternity. So I think we must congratulate people like you for taking preemptive steps, waiting for the third wave. And I hope, as you said, that we do not get the third wave. But at least, as we always believe, prevention is better than cure. Let us be ready for the third wave. That is a better thing than trying to, at the last moment, like how we did in the second wave. We were helter-skelter roaming about. So congratulations on this award, and hope you continue the good work. Thank you. Thank you.
Thank you, sir. Thank you very much.
Thank you so much, Dr. Ketan Apte, for being with us, and Dr. Ashish, of course, for introducing him to us and really making it possible to have him with us today. With all gratitude, Dr. Ketan Apte. We move on to the next award now, the RSG Excellence Award in Patient Care, to another of the hospitals, which we have seen it from very close, the Kaushal Medical Foundation Trust Hospital. For 2 decades, Kaushal Medical Foundation Trust Hospital is well known for providing high quality treatment at reasonable cost in our Thane city. We are absolutely proud of them. They have provided charitable treatment to thousands of patients from Thane and districts since 1986, first as 15 beds hospital near the station, and since 2002, they have a current location with 100 beds. And of course, that till now nearly that's the number of beds, but it's going to expand. They were one of the first hospitals to offer service at DCH in Thane on from 17th of April 2020. Till now, nearly 4,000 COVID patients have been treated at the hospital, including 300 plus ICU patients. During both the first and the second waves, it was the first preference of all Thanekars for COVID treatment. They have also vaccinated more than 13,000 in their CDC. Now they are all geared for the big step as they expand to 150 beds in next few months, which will include 50 critical care beds divided into ICU, ICCU, HDU, IPCU, and NICU wards. I would also like to take the privilege to introduce the trustees. They are again, just as Dr. Ketan Apte, the young generation and the young strength that is really going to take us out from this pandemic. Firstly, of course, Dr. Amol Bhanushali is consultant thoracic and minimal access surgeon, Kaushalya Hospital, Thane, PD Hinduja Hospital, Leelavati Hospital, and Apollo Hospital, Navi Mumbai. He's medical director with the Dr. Bhanushali Hospital and Center for Lung Surgery, Thane. And Dr. Samit Soni, of course, who's really, of course, made this happen. And we have done a lot of programs with him. He's the orthopedic surgeon, joint replacement surgeon for the last 2 decades. And he's MBBS, DNB, MS from KM Hospital and GS Medical College. And he practices at, of course, the Kaushalya Medical Foundation Trust Hospital and the Bhanushali Hospital in Thane. So it's a proud privilege really to be with both of you. We have seen it, and the programs I've done with Dr. Sameep Soni is we know patients have come outright saying that the kind of care that they have provided, and in the first wave, of course, and the second wave has been even more difficult. So I would actually um, uh, really request both of you to say a few words before we actually present you the award.
Yes, firstly, congratulations to Rajashri and her team for this grand function. I think it's a fantastic event which you are holding every year. I was part of this event even before the COVID struck us, and at that time it was at Fortune, and it was a grand event at that time as well. Obviously, in person, here it is a virtual platform, but all the same, the grandness, the dignitaries who are present on this dais, it's a privilege to receive this award. Regarding our journey, uh, Kaushalya Hospital is a trust hospital, and since 34 years, the trust has worked for giving service to patients of Thane city. And when the pandemic struck us, we were actually in a, you can say, the hospital was in a renovation mode. We were expanding. There were a lot of civil work going on in the hospital. We were actually down by around 25% of the of our routine strength, and we got a call from the office of the commissioner that from tomorrow you will have to work as a dedicated COVID hospital. At that time, also around 30 patients were admitted, non-COVID obviously, and we had to just transfer all of them to the other nursing homes and other hospitals. And absolutely, there was, you can say, a state of shock that to work as a COVID hospital, it was the first time, first wave, and nobody had any idea of how to even wear a PP. Forget about how to don and off properly. What were the precautions? None of the staff were actually willing at first. They had come and they were waiting outside the hospital, and their queries were very genuine that we are ready to work, but we cannot go home and infect our family as well. So we sort of decided that we should address those problems, and in exactly 72 hours, we made provision for stay of 100 people in a hostel, which we sort of fast tracked it so that people could stay there and work from that hostel and give service to the hospital. And we expanded from our 60 strength to 100 in less than 1 month. And that is how the COVID work started at Kaushalya Hospital in March and April 2020. And I must thank all the staff members, especially all the nurses, the healthcare, the sanitary workers, the doctors, the RMOs who have supported us for treating. And till now, we have treated almost 4,000 COVID patients in the first as well as the second wave. Still, there are COVID patients getting admitted, and a bit of concern since last couple of days the number of patients is increasing. So we have to be prepared for the third wave as well. And I would like to thank the staff members again, and especially our trustees, Dr. Bhanushali sir, Dr. Sohni, Dr. LV Sohni, and obviously my parents, and Dr. Amol, who has been the, you can say, both of us together, we sort of handhold each other and take the decisions together. And it was a fantastic journey, and a lot of help from him as well in this entire pandemic. So over to Amol. Whatever I have missed, he will cover.
Um, good morning to all, and it's a privilege to be here on this forum today. Thank you so much for considering us for this award, and it's a privilege to have be on this forum, especially in the presence of Utture sir, who is one of our role models in surgery. So, very good morning, sir. Uh, uh, from where Sameep left off, uh, like he said, it was a real challenge in the beginning uh, to get the staff ready and get them to work and make arrangements for them and set protocols. And I mean, of course, all hospitals must have faced these challenges. But since we were already under renovation and repairs and construction, it was slightly more challenging for us. But with cooperation of the TMC Health Department also, and a lot of efforts from each and every member of the Kaushalya Parivar, right from the trustees till the ward boy, till the uh, anybody and everybody, till the security person, and everybody put in a lot of efforts to put us into this situation that we are today. And now we are expanding to 150 beds, so that I hope it doesn't, but if the third wave arises, we are in a better position to give more number of beds and offer services to more number of patients, especially even pediatric patients, since we are coming up with a dedicated PICU and NICU as well. Also, we have started treating post-COVID sequelae as well. We have treated few cases of mucormycosis, not just rhinocerebral, but also pulmonary. I myself being a thoracic surgeon, we have also done a few lobectomies for pulmonary mucormycosis, as well as post-COVID sequelae of pulmonary pneumothorax with air leaks and getting converted to empyemas, and so these surgeries are also taking place at Kaushalya. So we are doing a lot of work in terms of post-COVID management as well, and number of these complications and number of these cases are also going up by the day. Also, our vaccination program is going on in full swing. We have started doing workplace and society vaccinations as well in Thane. So these are some of the new arenas that we are developing in. So we hope to complete our expansion project hopefully before the third wave, so that we are more prepared and we are back in action to continue serving the citizens of Thane city. So once again, thanks a lot for. Also, we were another proud privilege for us is to have Dr. Sanjay Oak sir joining us as Director Professional Services, and that happened in January 2021. I would say at a very crucial time just before the second wave, and he was also very instrumental in sailing us through the second wave in spite of tough times. So once again, thanks a lot for inviting us and considering us worthy of this award. Thank you so much.
Well, I'm glad that both of you made a mention of senior Dr. Bhanushali sir, Dr. Sohni sir, madam as well, and
Sir is here, right, sitting right next to me.
oh wow. Well, that it couldn't have been, the wisdom and excellence program cannot actually get over without him being on it. Dr. Amol Bhanushali, I can't thank you enough for doing this. Sir, it's such a proud privilege to have you with us, and you should, if he can say a few words, that will be that can be the best.
First of all, I thank you for giving both Dr. Samip and Dr. Amol this very important honor for giving us such a, on the name of a famous person, Dr. Gadgil, who was my really friend. And we were together for many years for the conferences of both regional conferences and even national conferences. He used to help us from the beginning till end. And he was instrumental for giving us so many opportunities as far as finance is concerned, the advice is concerned, and his methodology was so good that once in Assam, Guwahati, whole town he has acquired for the conference, and it was named as Dr. Gadgil's conference. But he had done it from his heart just to help for national cause. I really remember that his was the unique personality who has given his whole life for the benefit of the medical fraternity to be on the in the national stage also, plus the state stage also and national stage also. I just remember him and tell you that the opportunity which you are now giving for the youngsters is unique, and he would have liked it if it had started before. Thank you very much.
So these are really the legends that we are having with us, and sir has actually been instrumental in showing the direction for people in Thane, of course, by setting up the Kaushalya Medical Foundation Hospital. So it's absolutely a proud privilege to have him and have both of you, Dr. Amol Bhanushali and Dr. Sameep Soni, with us. And on that note, I will request Dr. Shiv Kumar Oture sir to do the honors of presenting the award to the entire group and to such great people. And of course, Dr. Sanjay O, his mention has to, as you did make Dr. Amol, is absolutely wisdom and excellence. All of them are far wisdom and excellence, I would say. Over to you, Dr. Oture sir.
Namaskar, Bhanushali sir.
Thank you. Thank you.
Amol, we have not only learned surgery from your father, but even patient care and how to talk with the patients from him. He is a great personality. And I must acknowledge his contribution towards all the surgeons of Mumbai. And I think congratulations both to Dr. Amol, Dr. Sameep, and your whole group for having got this award. And it is great, Rajeshri, hearing from these youngsters of how they are planning for the future also. It is not just that what they have done, but the steps that they are taking as far as the next wave is concerned and how to tackle that, especially though being surgeons and orthopedic surgeons, they are talking about MICUs and PICUs, and that is something that you have to appreciate. So we are going back to the old concept of all encompassing doctors, not just specialists and super specialists in their field. And this is what this pandemic has taught us. And of course, with Dr. Bhanushali there and his hand over their heads, I don't think they can do anything wrong over there. And I congratulate them and wish them all the best as far as their future endeavors are concerned. Thank you, sir.
Thank you so much, sir. Thank you so much once again.
Rajeshri madam, you're muted.
I would like to thank thank all of you, for this honor really, and I would thank the spirit of RSG because of which this has really been possible. And thank you very much for making this ceremony, taking it to its epitome of wisdom and excellence. And we will continue with it further down now, of course, with the next award, but I would like to thank Dr. Amol Bhanushali, Dr. Sameep Sohni. Dr. Sameep, really thank you very much for making this happen. And of course, Senior Bhanushali sir for being with us today. Over to the next award, which goes to the RSG Excellence Award in Patient Care, which goes to the Jahangir Group of Hospitals. Yet another very trustworthy name, being one of the oldest and most renowned names in Pune. Jahangir Hospital, with a legacy of providing quality healthcare services for over 75 years, holds a steadfast position of trust and respect in the people's hearts and minds. Jahangir Hospital Group of Hospitals is a 400-bedded hospital with 2 branches at Pune, treating more than 150 specialties and having 9 centers of excellence. Their mission is to provide healthcare of international standards through a team of qualified professionals at an affordable cost. They are also committed to clinical excellence by focusing on healthcare academics and state-of-art technology. Jahangir Group of Hospitals is expanding its boundaries under the leadership of its CEO, Dr. Vinod Sawantwadkar, who is with us today. It's a privilege to have him. He is MPhil in Hospital and Health System Management from BITS Pilani and CMC Vellore. He's MBA from one of the prestigious institutes of ICFAI University, Dehradun, in marketing and HR. And to do the honors, of course, I would like to invite Dr. Ashish Arbut uh, to say, welcome him with his kind words, without which the introduction cannot be complete. Absolutely. Over to you, Dr. Ashish Arbut.
Good morning, sir. And Rajeshri, again, it's been a privilege to know this person in person. He's been a good friend, very methodical. There are a lot of things to learn from this man in terms of people management. He has come to an institute, if I can mention, from a complete corporate background to a big family run breach candy kind of a setup, where it was really difficult for him, because when he came and this COVID wave started, to learn the intricacies of the big legacy of Jahangir. I'm a family member of it, and the vision he showed from the first meeting to I meet him almost every day now, but a lot of things to learn from him. I respect him immensely as a person, and I seriously feel that we look to a big teacher in coming time, how to manage people, how to have respects of the veterans there, get the new things and the changes in a privileged kind of environment where everything is so historical, so massive. And he has been one of the highest loads of patients coming pan Maharashtra, pan India to these centers, including big ministers and whatnot getting admitted. And it was a difficult journey, like everybody mentioned, like Ketan mentioned, and they have really made it a point to give service to everyone, right from the PMC care to, and I seriously feel that we can hear his words, learn from him, and we are learning every day from him. I'm very proud to be associated with this group and his faith in me. Vinod sir, over to you, and whatever is said is less, and we can hear your visionary words again.
Thank you, Dr. Arbut. Am I audible to everyone? And very good morning to a very prestigious and a dignified group which is here. There are a lot of senior doctors, Rajeshri Madam and the complete team of TRUWELLTH Health. There are advantages and disadvantages of speaking in the end. The disadvantage is that you find, you have to actually catch with, what you need to speak, because there's a lot which has been spoken already. So it so happened that in May 2020, I landed up in a hospital. I took up this position of a CEO of Jahangir Hospital. And then, you're in mid of COVID. So you need to now start, knowing your grounds, because it is not a regular way of working. All the regular things are not moving, and it's all COVID. People are scared. The protocols are different. Everything is different. And when you are at a leadership level, the only thing which you can bet on is the teamwork. You need to get along with the people very well, and you don't have much time. So in COVID time, I think so it's the highest level of accountability and adaptability when we talk about the teamwork. You have a team, you have a stalwart doctors who are who are into practice for many years, who are associated with your hospital. And that's few of the typical things with the hospitals which are very old. You have a staff which is 25 years in a service, 30 years in a service. You have doctors who have been with you for more than 25 years, and you are the only person who is new in a system, and then to ride and then to take the organization ahead was a challenge. But if typically we describe, it's like a cricket match. When Ganguly was there, he created his new team and he moved it ahead. But when Dhoni came into the team, he had already stalwarts in the team. So it was more to be, him to be quiet and take inputs from them and try to act like a facilitator. That exactly has been my role when with Jahangir. We have a very good team. We set the right protocols. Initially, it was a nuance of the disease which we are trying to understand, trying to create an infrastructure, maybe in terms of the ventilators, maybe in terms of the BiPAPs, organizing the beds, making the team, setting the protocols, like the basic logistic issues, like ensuring not only you treat patient very well, but at the same time we were ensuring that our own staff don't get knocked down with the COVID, and they had to be in isolation. So we had to organize for their the hostels. We also took over the some of the hotels to ensure that their accommodation has been taken care, because I rightly said it was a highest level of people management, and they were the people who are actually managing the patient day in day out, in spite of all the panic situation which was happening outside. I was lucky to have a very good team of the consultants with us, many senior consultant, young consultant also, who were very quick to form the group, and on and off as and when required, with the help of medical director, come and show me what we need to do. And for me it was very very easy just to tell them go ahead, because I am blessed to have such a nice and a very very powerful team of the doctors, of the nursing, and even our the housekeeping staff and technician. I would tell you, managing the pandemic was not easy. Even the security person who was standing outside has played an extremely good role in instructing people what to do, what not to do, how to come in a staggered manner, what is the distancing which need to be kept. And of course, things started moving on. In mid of August, hospital was hit by a very very small strike of the nursing. I saw the entire nursing staff moving out. Of course, there were various other demands, and the problem was I'm in the middle of COVID, having around close to 150 patients admitted in a hospital, and the entire nursing staff is out, and they had some demand to be addressed, and I was absolutely new in the system. Over just 2 months got inducted in a system, but with the help of my team we could then sort it out and then could build the confidence in the team, because the team was very panicked. They were looking for a motivation, they were looking for a pep talk. Then I don't know how many hospitals have actually done that, but somewhere in October we went ahead by doing the appraisal to the entire staff. That was an era wherein people were actually doing a salary cut. People were saying that the things are not moving very well. Let us reduce the manpower. Let us take a here and there salary cut to make the to make the entire economics work very well. But we as a hospital, thanks to the my board, to trustees who actually bestowed that confidence in me and guided me, and we could go ahead and we could actually even do appraisal for the people. We have also given a free treatment for all our staff who actually during treating COVID got infected, got admitted. So as a hospital, we have taken care of all these things, and that's where I see people management was very very critical, along with the management of the equipments and other things. When we actually moved into the second wave, as I said, first wave of more of a newness of the disease. Second wave was the disease was already known, but it was more of a resource management. So we could see, unlike the first wave which came up slowly and gradually, the second wave of up at blink of your eye. And then we saw the entire country getting into the same dynamics of trying to, look at the medicines, antiviral, other things, looking at the, all of a sudden there was a gap of oxygen. But we as a hospital didn't face much of problem apart from the medicine part of it, but which was well made available by the government with the help of collector's office and all. But as far as the O2 and other things were concerned, I would definitely say that hospital need to think very seriously when it comes to this added facility, having enough oxygen vessels, wherever possible, having, association with the renowned service providers, maybe, Linde, Inox, or any of them, because, and our stakeholders actually helped us very, very well. When we spoke to them, they gave us a confidence saying that you don't have to worry. If you require, we will keep, gas O2 cylinders or O2 tankers at your premises, wherein at no point of time you go less on the supply or less on the O2 consumptions. I think so. The entire first and second wave has been an absolutely testing period for the hospitals, which otherwise administrators like me would have not gone into a detail of, basically the O2 supply, what is the total consumption of oxygen per day. Like we have a vessel of close to 6,000 KL, which can storage, and my average performance in past was, 1,500 kiloliter. But now during the pandemic time, it went up to, 2,800 to 3,000 kiloliter per day. And then all of a sudden your pressure gauges started making noise, and then you need to look at the system, which otherwise would have not been possible. So I know this has been a great learning for all of us in terms of the actual complete administration and management of the facility also is concerned, in terms of medical equipment, in terms of the patient management, in terms of the team management. We also were very, very innovative because the beds were falling very short, and we being one of the renowned hospital in Pune, there were a lot of calls which were coming, which Dr. Arbert also said, and most of us must have gone through that phase. So, and we had to address to the need of the people, because that's a basic need. We cannot say that we don't have a bed or we cannot give you services. So we ventured into something called as home isolation. We treated close to 1,000 patients in home isolation. We also took over some of the hotels, and the milder cases we were treating at the hotel, of course, with the help of the nursing staff and deputing the doctors over there. So these are the few things we started. Because we also had a regular patients coming in apart from the COVID patient. To segregate it, we started flu OPD, fever OPD dedicated for that. We also used, much spoken in past, something like telemedicine. We deputed few of the doctors and the staff to day in, day out, talk to the people continuously over the video conference, understand their health, what is a requirement, and if they require, they are getting very critical, then, shift them to the hospital. So all those processes and all those technology utilization which happened during that time. In the second wave, as I said, the resource management, after that, we immediately struck with the mucormycosis, we call it black fungus. We have treated close to around 80 patients for mucormycosis. And then we started our vaccination drive as a hospital. We have finished close to 60,000 vaccinations, till till yesterday, and we intend to do at least more than a lakh of inoculation in next 1 month time. We operate with close to around 8 to 10 teams going to the various corporates. We are having a huge drive at the hospital premise, at also our hospital at Kothurud. Apart from Sassoon Hospital, we have had an association, and a lot of schools came forward, because currently schools are not functioning from their premise. They are also gone on virtual. So they have given their premise at no cost, saying that why don't you run the vaccination drive from our premise. They have been very, very kind. We have also started that, and we are inoculating close to 500 to 600 people from the school premises. So we have been doing all this so that we give more and more comfort to the people. They don't have to travel, because traveling far off places, having a huge gathering at one place could also, transmit the, the infection. So which we are trying to avoid. We are creating a small group, small booth, and we are doing roughly around, in a day we are doing close to 3,000 to 4,000 vaccination, including including hospital, including school, including the corporates. And that is something which we feel is 70% answer to the spread of vaccination, to the spread of infection. So you want to vaccinate more and more people, and of course, and then put up the strict protocols in terms of how one need to take care of themselves. So and that is how we intend to get the burden down. There was a lot of talk in terms of all of a sudden the vaccination price capping coming on the price, and we were also talking to media, and media was calling, how do you see this is getting addressed, because initially there was no much capping and people were doing at a various price points. So we said, yeah, that's one thing, but the diehard and the requirement of our nation right now is to vaccinate more and more people, rather than looking at the higher price margin or lower price margin. Till the time we are able to take care of our cost which we are putting in terms of buying the vaccine and the and the manpower which we are applying. I think as a hospital we are very fair with that, and we want to vaccinate more and more people, so that the third wave which people are talking, we would like to keep that third wave at a bay. And that's precisely what we are trying to do. Once again, thank you so much for your entire team, Rajeshri madam, for having us here. Very thanks to, it's very kind to know Dr. Utture, Dr. Rekha, and the complete Dr. Banushali and the complete team. And of course, I've been seeing Ketan first time, though we are in Pune itself, but because of COVID, we could not even meet each other. Thank you very much for having Jahangir Hospital on behalf of the entire hospital. Thank you to the entire team and all the best. Thank you so much.
It's commendable to see that how much you have already taken up, despite taking the plunge just through in the COVID times, and the way you have actually handled, and like you mentioned, right from the security guard to the utmost the ICU, where you're taking the utmost care. You've actually planned everything, and it's really great, and great to know, and a privilege, of course, to award you and award the Jahangir Group of Hospitals. Thank you very much for being here. I would request Dr. Utture sir again to do the honors, and Dr. Sawantwarkar, you're at the tail end. No, you're not at the tail end at all. You've accomplished so much, and it's really a proud privilege. I would like Dr. Utture to say a few words and give the award to Jahangir Group of Hospitals.
Yeah, thank you, Rajeshri. I think Sawantwarkar and whole team of Jahangir, congratulations for having got this award. And one thing I would like to mention, one very important aspect which he brought out, that the success of management of this whole pandemic fell even not only on the public sector but even on the private sector to a great extent. And unfortunately, unlike any other country, almost 75% of the health has been by the private sector in India. But what he brought out was that they have been successful in managing purely because of the teamwork which has happened. And I think I must congratulate you for that, because decisions cannot, as I said right in the beginning of my speech also, that decisions cannot be taken by the administrators alone, because they do not know on groundwork what the doctors, what the sanitation person, what the nursing staff, what they are facing. And it is only when you take all of them into confidence and you formulate the protocols of how to go about, I think that speaks volumes for the success that Jahangir has got, and for that matter, any of these corporate hospitals who have played, especially in these big cities like Mumbai, Pune, Nagpur, everywhere, they have played a big role in trying to contain this disease. So I think that should be the ethos of all administrators everywhere, where they bring on board the clinicians, the nursing staff, the sanitation people, right up to, as you said, right up to that security who's at the gate, and take them into confidence. And then only I think you can have this success that you have had. And I wish you all the best even for the future, because we are not yet done with this pandemic. It is still going to be there in the future also for us. So your role is going to be important even in the future. So all the best and congratulations on that award.
Thank you.
Thank you so much, Dr. Uttre sir and Dr. Ashish Arbat. Thank you for making this happen. We have been bothering you to coordinate and make it happen. Thank you so much again. On that note, I would want Dr. Rekha Bhatkande, madam, to say a few words. She has been in this situation, both in the management and the board, and she knows, she's seen how this has been through COVID as well, because she's also been associated with the social hospital relentlessly through this COVID, taking calls, coordinating things. Madam, what would you want to say about the awards that the coveted hospitals have received today? If you could say a few words.
Rajeshri, thank you so much. I mean, in this celebration of the 75th birth anniversary of your father, I think this has been an excellent award that you have initiated. I can relate with all the hospitals that have received this award, because I remember in April 2020 when we received our first patient. COVID patient, because BMC at that time we had a new unit. Shusha Hospital is a cooperative hospital, and we had and our main hospital is in Dadar, which is 50 years old. But we have a new unit at Vikroli, and because it was new and they were, we had 140 beds. The BMC then wanted to make it a dedicated COVID hospital. And I was listening to about how people didn't even know how to put PPEs. Yes, we actually had the WHO representative coming and training our staff as to how to wear how to doff and don and doff PPEs. We had the BNC staff, which did an excellent job, coming and training our staff were the basics of sanitation, and because sanitization of the hospital was a very major thing, because this is right from the beginning. No one knew anything about this virus, and we actually just plunged into it. And I know that I was at, my daughter had just picked me up from my own house and taken me to her place, saying that this is the lockdown and things like that. And the place that I was residing in, Kalanagar, had actually gone into the first zonal lockdown, red zone or whatever it was. So I couldn't even make it to Shusha Vikroli. So I was on the phone 24/7, and believe me, it was 24/7, because we were at that time, it was not decentralized, the patient care, the it was the disaster cell of Mumbai was coordinating everything. And so they would ring up saying that there's a patient, do you have an ICU bed? And then that time we only had 5 ventilators, and and then luckily for us, a lot of donors gave it, including the PMO, so more ventilators. So it was a very tough time. And what Dr. Uttere said was very right. Every day, so was very generous saying every week, every 15 days, but believe me, at ground level, every day the directives were changing. Every day we had to make new dashboards. The information was going from to the PMO, CMO, to the disaster cell, to the BMC. It was, and it only worked because everybody was on the same page. It didn't matter whether it was the security man who was who had to, divert the ambulances, and it didn't matter whether it was the administrator who was looking after the hospital. Everybody had to work, and we could do it because we were all on the same page. And I was just talking to them on the phone, Rajeshri, imagine that. And I knew my hospital, I knew my staff, and I knew how the pandemic was panning out. So I could actually, we could do it. And I mean, I think the healthcare sector has really, really responded. They've done a wonderful job, and all these hospitals have done their own thing, and they've done a wonderful job. I'm so happy, and I congratulate everybody.
Thank you so much, ma'am. That coming from you means a lot to all of us here. On that note, we will, of course, get on to the next awards. And Dr. Bhatkande, ma'am, you're going to be with us. So your appreciation, bit comes much later from our side. So with that, I would like to, another unique company we have on our awards list today, and they have done such a great job. First, I would like to introduce this company, High Media Laboratories, which is receiving the RSG Excellence Award in Patient Care. High Media Laboratories is a leading bioscience company with a global presence in more than 150 countries, and it's among the top 3 brands in microbiology in the world, with its legacy of 45 years of innovation and more than 30,000 SKUs, with global offices in USA, Germany, and more. Having expertise in innovation and manufacturing of microbiology, cell culture, and plant tissue culture, molecular biology, diagnostic, chemicals, laboratory equipment, and hydroponic solutions. They have received several awards. 2020, High Media actually received the BioRack Innovator Award under the category of therapeutics, vaccines, and drug delivery by the Biotechnology Industry Research Assistance Council. 2018, High Media had been bestowed with the most prestigious Pride of Maharashtra Award under the category of the Best Company of the Year Award by the Maharashtra Industrial Economic Development Association. With innovation and quick adaptation and collaborations, they made COVID testing, RT-PCR, antigen, and antibody kits on a very large scale to meet the high demands. I would request Dr. Vishal and Dr. Rahul, who we are very proud of, to come forth to receive the award, of course, and to speak with us and share with us all the achievements of High Media, especially in this pandemic. To quickly introduce Dr. Vishal Warke, because his introduction is not going to be easy in short words. He's Director R&D, Animal Cell Culture, Immunology, Plant Tissue Culture, and Hydronics Division with the High Media Laboratories Private Limited. He's PhD in Cell Biology and Molecular Genetics, University of Maryland at College Park, UMCP, which is he's of course done his MBBS from the Lokmanya Tilak Municipal Medical College, LTMMC Science, and biotechnology professor involved with development of advanced technologies and products such as stem and primary cells and their media, chemically defined media for biosimilars in animal cell culture. Successfully developed and commercialized a comprehensive range of hydroponic nutrients and turnkey projects and services. And Dr. Rahul Warke, well-known scientist and expert in international business marketing, Director of Research and Development Wing of Microbiology Business at High Media Laboratories Private Limited. He completed his master's as well as his doctoral research in microbiology from Institute of Chemical Technology, Mumbai, of course, and later he enrolled as a researcher in the biological warfare program of the US Navy and continued working with the Department of Cellular Injury, Walter Reed Army Institute of Research, Maryland. Being the next gen leader, his technical expertise and vision has led to expansion of horizons for High Media's microbiology business. And Such are these two doctors, and of course, we can't but remember Father's Day, their great father, who's also a legend, and he recently, of course, received an award as well, which I'm sure both of you will share with us. But both of you are my schoolmates. I can't but say mention that. And Rahul has been my classmate. But the amount of work that you have done, and which I came to know through the COVID pandemic, has been just amazing. And reason why, I think the award and you, I mean, wisdom and excellence is right there. So I would request both of you to say a few words. I know Dr. Vishal is going to initiate, but we would also want Dr. Rahul to, um, tell us about all that have you been doing through these times, and how we can sort of learn and get inspired by the work that you've been doing.
Vishal, why don't you start?
Okay, thank you. Thank you very much for the award and for this wonderful introduction. You have been very kind with your words. Thank you very much. What I will do is I have a small presentation, a PowerPoint presentation, and I will share the screen so that everybody can see that. Are you able to see the screen by any chance?
No.
No? Okay. So maybe Rahul, you go ahead and you talk a bit about the things that we have been doing, the mucormycosis and other kits. In the meanwhile, I'll get this fixed.
You can try sharing this screen instead of just trying to share the presentation. That might help. Over to you, Rahul, really.
You shall just, do you try share screen option?
Yeah, it is asking things like desktop one and all these things. So
okay, we'll try to help you at the back end.
Okay.
No, don't. I'll figure it out. Yes.
So thank you again, Rajeshri, for the award and the wonderful introduction. We at High Media, being a 45-year-old company, we had a legacy of microbiology product line. Of course, with the help of Indian scientists, doctors, and medical fraternity, we were able to grow. And eventually, in the late 70s, we started our export to Japan, and that's where we came to the point as world class, where our products, whatever we made, was supposed to be world class, and that's we stuck to. Quality has been a big backbone of our industry. We spend quite a bit on our research and development, and as Rajesh already mentioned, that we have multiple product lines, right from microbiology to immunology, cell biology, molecular biology. And COVID definitely was a time where we took an upper hand, where we really pulled up our socks. When the COVID pandemic came in the month of March, Vishal will talk about this more in detail, but we were the only company making a VTM in the entire country. So we ramped up production and started making that. In another few weeks, we came up with our molecular diagnostic kits, that is RT-PCR and RNA extraction kits. And that also we were supplying pan-India, and we're still doing that. But as part of microbiology, being a microbiologist, my role came in the last 2-3 months when the mucormycosis happened. And with the help of different hospitals, the first thing we needed to get the strains. So we got hold of strains, BJ Medical Pune, PGI Chandigarh, Mumbai, a few hospitals in Mumbai helped us get the strain. The moment we had the strain, we characterized the strains, and we developed a very easy kit. So the kit was basically, you have a very selective nasal swab. You swab it, not nasal, it's basically a viscous swab. You can either take a swab of the eyes or the discharges from eyes and nose, and just put it in a tube and bring it to the lab, and then we develop very selective medias where in a matter of 18 to 24 hours you're able to grow. And see, the challenge with mucormycosis, I understand, is finding the right drug of choice. So antibiotic sensitivity becomes a big issue. Molecular tests are great, but they don't give you what is the antibiotic sensitivity profiles of these isolates. Now, as we all know and aware that mucormycosis is not one strain. These are multiple fungi in different parts of the country which are causing this infection. Even in one hospital, you will find different species causing this mucormycosis, of course, depending where the patient gets it from. So what becomes of utmost importance is drug of choice. So getting the test done in 48 hours is where we came in picture. So first is the challenge of selectively isolating the mucormycosis strain. Now, there are multiple fungi which were responsible. Now we are seeing Candida auris, which was a pathogen which has been coming in the headlines in the last 1.5 years. Candida auris is also creating a little bit of havoc under mucormycosis. So the 3 different types of fungi which predominantly need to be differentiated, identified, and then take it further on the basic antibiotic sensitivity tests. So these antibiotic sensitivity tests then help you decide the drug of choice. It's a completely different story that what drugs are available in the market today and what can be used. But at least one has an idea that if I get this drug or if I can try to procure this drug, it will be the right drug of choice. So that was our, that is how we developed this kit, and it is now being used. We in fact validating it in a few hospitals. So if any of you need some help, any of the doctors on this forum need help with characterization of this fungi, our lab is more than available. We do it more as an academic activity, and as I keep telling all the doctors that you all are sitting on gold mines as microbiologists, you have access to these clinical isolates, which help us develop products which would be easier for all of you to deal with eventually. So I see mucormycosis not going away for a while, because I've been speaking to a few doctors in and around Maharashtra, also up in north. And now a lot of patients who have been discharged are coming back after a few weeks, months with mucormycosis infections. So these are patients who have been COVID negative discharged, now they're coming back. So mucormycosis is something I think we'll have to deal with this in a more systematic way and responsibly, because we need to see we keep using the right drug and don't lead to an multi-drug resistant mucormycotic strain here. So as it is, this strain right now, we found amphotericin B is a drug of choice, and somewhere it works. So I feel we should. So now I'll hand it over to Vishal. He will talk more about high media and what he and we played a bigger role in terms of the VTM and the RNA extraction and the RNA kit. My role starts now, and maybe down the line I can give you a better update at how and we were able to help the medical doctors in terms of diagnostics. Vishal?
Great. Over to Dr. Vishal now.
So is this visible now?
Yes.
Okay. So thanks, Rahul, for giving that overview, especially the micro part for the mucormycosis and the other kits. So I will quickly go over this presentation. Rajesh, just let me know how much detail is okay or not okay. There are a few slides just to set a tone and let people have an idea about high media.
Yes.
So high media was started in 1973, actually, by my father, my uncle, and my mother. My father is a PhD in microbiology from Mumbai University. And when he was doing his research, the media was imported in India from US and Europe. And it was extremely expensive to use these media. And at that time, actually, this media gram to gram was more expensive than gold, because gold was only 60-70 rupees a tola at that point in time. So when this media would get rationed out, so as a microbiologist, you would wonder, how can a scientist actually do research if the reagents themselves are so expensive, if the media is so expensive? So though he was working in the pharma, just a minute. Yeah, so though he was working in the pharma at that time, he still had this dream of making media in India, because he was doing earn and learn, where he would work and go in the lab and do research in the evenings, at night, and in the weekends. So when he actually started, at that time, there were certain issues in India. For example, there was currency devaluation. So it was a lot of challenge. There were many challenges to actually procure material from abroad, because there were, along with that, also stringent foreign exchange norms. The imports were very expensive and time consuming. If somebody wanted to buy a reagent, one had to order 2 to 3 months in advance, because the material just would not come in time. And most of the time, even what was ordered would come in as an expired product or close to expiry. So there was a lot of red tapeism. One had to go through a lot of files, and the license charge was active at that time. So in this situation, because of these increasing hardships for scientists and researchers in India, my father and my uncle and mother, they three decided to take the jump, leap, and they started making media in the kitchen of our home. So we were living in an apartment in Thane East at that time. And in the kitchen of our home, they started making the media, filling it in bottles and selling it. So my uncle is the marketing director today. My mother is the IT director, because she's also a computer scientist, computer engineer. And my father is the technical brain behind this startup. So this is how High Media was started. Officially, we bought a space in Ghatkopar in 1976. And that's where the first office of High Media was started. Incidentally, in 2021, we would be moving out of that office after 45 years and coming to Thane at Wagle Estate. So what struggles did we face in the beginning? There was a mental block of a lot of the people, the scientists and the technicians. They had never used off-the-shelf powdered media that we were offering. So what people did was they actually would go to the butcher shop, get meat, liver, heart, and organs, and make extracts out of these. And they would add sodium chloride, agar, yeast extract in the lab, and try to make a medium and use that. Most people had never seen media in a bottle, because only the ivory towers or the topmost rich institutes in India could afford whatever media they could buy at that time. So there was a mental block. People didn't know, is this media good? Should we use it? Would it work? So we told them that you use the media to the last gram in the bottle. If it doesn't work, we are here. You can always return us, and don't pay us till you are satisfied with the product. So like this, a trust for off-the-shelf powdered media, quality culture media was developed by us. And not just the product, but we offered them a product service package, which we do even today. A lot of times, scientists, doctors, pathologists, they have difficulties, they have problems where they are not able to, there are certain things. For example, once 10 years ago, we got a complaint about precipitation in a certain medium. And we understood from the user that the user was actually making a double strength medium. And because he was making a double strength Mekongki's agar and storing in the fridge for a certain period of time, it was precipitating. And then we troubleshooted that and came up with a product which would meet the user's needs. So this has been our forte. And this has also opened doors for us in America, Europe, 150 countries all over the world. Wherever we export, people prefer High Media because we talk to the end users, to the scientists one-on-one, and address their issues. And this is how this brand was established over so many years. Today, we have the largest range of culture media in the world. Actually, we are the largest media manufacturer in the world today, because the amount of SKUs that we carry, nobody else in the world has. The large companies, generally what they do is, as they grow, they want to maximize profits. And so it's just about the profit and loss and the balance sheet. So they cut down on many products which may not be giving them the revenue that they want. And as per Pareto principle, 80% of your revenue is going to come from 20% of your products. And 20% of your revenue ends up coming from 80% of your products. So these 80%, which do not give much revenue, are cut short or are taken off the offering by most companies, But in high media, we don't do that. What we do is we offer all these other products because there are scientists all over the world today who want these. And in fact, Rahul is the hardcore microbiologist. I mean, he can add things later if I miss something out. But to quickly sum up, the director of CDC, Center for Disease Control in Atlanta, they wrote to us in India and said that only 2 companies in the world were making a certain media for microbiology detection for the B12 agar, right? What was that?
Folic acid detection in
folic acid KC medium. Okay. Why don't you go ahead and just narrate the incident, what he said?
Yeah, so basically the detection of folic acid in serum has become a big priority, especially in the developed as well as underdeveloped countries. So over a period of time, people thought that automation using HPLCs and things like that was the answer to detection of these levels in blood and serum. But they realized a few years ago that the best assay is a bioassay, which you use using a lactobacilli casei organism which detects nanogram levels of folic acid in the blood. So CDC decided to shut down all their automated machine protocols and move back to the classical method. And the only 2 companies making it in the world was High Media and another company, Becton Dickinson, which everybody knows. So Becton Dickinson could not make the product anymore. So High Media is the only one making it right now. So CDC called us and said, do anything and make it for us. And so now CDC, and now it is up on their website. They recommend this protocol for everybody for detection of folic acid in serum using culture media.
Okay, so I think I'll just continue here, Rajashri, because the screen share, again, I'm not sure if it'll work if I hop off, but I'll just quickly, I'll just go ahead here. So we are exporting to over 150 countries today, as we have already, as you also read out before. We are OEM suppliers to reputed international brands, Sigma, Fluka, Merck. Many of these companies, they buy products from us and sell under their name also. We have a joint label with BWR. This is a huge conglomerate like Thermo Fisher in the United States. We have a joint label with them. Even Thermo Fisher, a very large conglomerate, which is around, I don't know, maybe 12 to $15 billion. They also source and buy products from us along with BWR. Another revolutionary achievement that we have in the field of microbiology is the high wedge media. And this is something very unique to high media in the whole world. We were pioneers in this. And today we have a broad range of media which are from vegetable source. As you might be aware, the microbes, when they are grown, they need a carbon source, they need a nitrogen source in the media. So the carbon source are generally sugars, the nitrogen source. So because the founding fathers like Robert Koch, Louis Pasteur, they were beef eaters, basically. They used to eat a lot of beef and it was available in bulk and cheap. So they used beef to start with as a nitrogen source in the media. And today, a lot of companies don't want anything with the beef because of the mad cow disease and because of adventitious viruses and things of that sort. So we developed a complete replacement to animal origin peptones or nitrogen sources by developing them from a vegetable source. So we have this range of high wedge media. Again, just a snapshot to show that we have export globally, and we have offices in 2 major continents of the world where we have our own staff with key people manning it, and these are very highly qualified people. In Germany, we have High Media GmbH just outside Frankfurt, and in North America, we have High Media LLC close to Philadelphia. We have a lot of quality systems with us. We are very highly well certified with a broad coverage, ISO 9001, ISO 13485, WHO GMP. We have CE marking for a majority of the products, FDA registered products. Plus we have NABL or ISO 17025. Just 2 quick snapshots of our main facility at Nashik. We have 12 manufacturing sites, or rather 12 sites where we have production, and then some sites are the lab sites. So this is at Nashik, Dindori, and this is a 12-acre facility. So these are pictures of that facility. And as we mentioned before, High Media has been recognized as amongst the top 3 microbiology companies in the world. This is a photo or a snapshot of the handbook of the microbiology media. and this is published by the ASM Press, or the American Society of Microbiology Press, which is in conjunction with the CRC Press. And these are international reputed, very famous publishing bodies. And for the first time, if you look in the overview on the right-hand side here, it mentions that the top 3 companies are Oxoid, High Media, and BD. So it's a great privilege and a prestige, not for High Media, but for all of us as Indians, because we have large and huge conglomerates in India who have thousands of crores of turnover. But how many times would you have an American or a European body ranking them as amongst the top 3 in the world? So this is what we have achieved over 45 years. And that's the greatest job satisfaction that we have. Again, just a quick snapshot. And here in the red box, you can see that highlighted, where you can see High Media along with Oxoid. Today, Oxoid is Thermo Fisher. So it's a huge conglomerate. And BD, everybody knows, because Becton Dickinson, BD Syringe, and it's a big medical diagnostics company. So contributions in COVID on the top, as you can see, the VTM kit. So in 2009, we had the swine flu pandemic or the epidemic. And in this epidemic, because it was quite big in India, at that time, the viral transport media were not available in India. They were imported from Europe and America, and they were extremely expensive. So the NIV, National Institute of Virology from Pune, they called us and said, can you please develop this? Because they knew that if somebody can do it in India, it's High Media. So they said, please develop this so that we can make much more affordable and cost effective, and the quality should be at par. So in a record period of time, we developed this medium and we got it validated from NIV. And for the last 12 years, we have been making this medium. So our medium, the VTM medium, is considered as a gold standard by the ICMR. So when the ICMR issues reports of the VTM validation, viral transport media validation, it is tested against High Media, and it is mentioned in the report. Another fact is that we are the largest producer of VTM kits in India. We can make 1 million tests per day. So we have ramped up to produce 10 lakh tests per day. And I have some anecdotal stories, quite interesting. When the pandemic started for the COVID last year, I got a call from Department of Promotion for Industry and Internal Trade. And the DPIIT secretary, he called me and said that he's reporting to Shri Narendra Modi directly, one-on-one. And he said that I am one touch from there. And because in India, the kits were needed desperately and nobody was making it. So he said that the whole nation is looking to you, because now you need to scale up and manufacture as much as you can. So from there we started, and that's where we got to 1 million tests per day. The next thing is we also have a medium known as COVID safe. So now in viral transport media, what happens is generally the medium is geared to collect the virus and keep it viable, so that when the virus reaches the lab, you can extract the nucleic acid, do PCR with it, or you can culture the virus also if you wish and do things with it. So this is how the VTM were developed. And at a certain point, people felt that because of leakage in the transportation, because of aerosolization during handling in the labs, a lot of people were concerned that there can be transmission of the COVID because of mishandling and leakage. So we developed a medium known as COVID safe. Now this is the VLTM, or the viral lysis transport medium. In this, what happens is the virus is lysed immediately. As soon as you put the patient sample in the VLTM or the COVID safe, the virus is lysed, killed, but the nucleic acid is kept intact. And that is a challenge because DNA is very safe. You can find DNA over millions of years. For example, insects in amber have been trapped for eons from the dinosaur era and before that. And people have been able to extract DNA of the woolly mammoth and such creatures over a period of time. The DNA stays intact, but the RNA is so fragile, it's immediately destroyed. So in this medium, the RNA is maintained. And this RNA can then be taken up for further PCR and processing. We also export a lot of these products outside of India. The British government, the national health authorities of the British government, and many countries in the world have approved us. The Dutch authorities, the European Union has approved these media. So they use our media as a gold standard. And it's a matter of prestige for us that against the Becton Dickinson and all these foreign players, an Indian company stands up against them and our products are considered as a quality standard. Another thing I want to mention here is the ELISA kit. So we had a quick joint venture, or rather a collaboration, I would say, with Syngene Biocon. Biocon is a famous company and Syngene is their CRO arm, and we developed the ELISA kit, which makes IgG antibodies and it's a quantitative kit right now that we are pitching. We started with the qualitative kit. The qualitative kit is also available. The qualitative ELISA is better than the CLIA kit because it has a better specificity. That is the advantage. And the quantitative IgG estimation kit we use very frequently in our lab and in many other places to monitor the IgG titers post-vaccination or post-COVID. And it's quite interesting to note that how the IgG titers vary after the first dose of vaccine, second dose of vaccine, and how they taper off over a period of time. So we have been following these things, and we have collected a lot of data on this, which we might publish at a certain point in time going ahead. Also, we are the first indigenous producer of automated RNA extraction kits. Again, when I came back from the United States after my PhD in 2003, I started the molecular biology division in high media. And in this, we developed DNA RNA extraction kits. So since then, we have been making these kits, also PCR kits. So my cousin, Dr. Rajas, he came in 2008. He's also a PhD in virology from University of Massachusetts. And he has set up a lot of automated extraction platforms. And this he did way before the pandemic. So when the pandemic hit, we were ready with these extraction systems. And that is what we were able to scale up in a big way. So that's, and plus along with that, we have also PCR kits for COVID testing. So this way we have the entire range of products, right from collection of the sample to extraction of RNA and doing PCR. Couple of other things I haven't put here, but I'll just mention to you. The trend is now changing. What is happening is now there is a new kit we are working with, and we are providing this kit. We are the first providers for this from ICMR. It's known as the Gadgil kit. So now what they have found out is you need not put the swabs in your nose and mouth, but if you do gargle, if you are gargling with the Gadgil kit, you can actually make this test happen. So like that, I have a lot of details, but I'll quickly go over it and finish it. And I just have some photos. Okay.
Sure.
I'll quickly just show these photos so people can appreciate. I'll wrap up quickly. This is the Rajiv Gandhi National Quality Award, the nation's highest quality award, which we won 2006. Again, we won this in 2011, and they told us that at that point, no company had won it twice. This is the highest quality award of the nation given to us at that time, and these are all union ministers. This is an award we got from Shri Venkaya Naidu, and this award I just got 2 months ago, which you also read out about the media design from Biotechnology Industry Council for media for the biosimilar production. And then this is a recent article just out last month where my father, Dr. G.M. Varke, who is 80 running, but fully active. He's the MD of the company and comes to the lab, comes to the office and works 10 hours every day, 6 days a week. So you see him on the left-hand side on the top here. And this article is there in Forbes. We were also featured on CNBC TV 18 recently. And this is hydroponics. And I will not go into this because we're running out of time, but later on people can contact. Just want to show you 2 things. One is this is Mahendra Singh Dhoni. We have set up a hydroponics project in his home in Ranchi. And these are the products, like, for example, broccoli and cucumbers and strawberries. You can see one small strawberry here on the top. And so at Dhoni's home, we have done this. He's one of the celebrity clients. We have many more. And we have a large project at Igatpuri. People are welcome to visit it. And we want to change the farming scape of this country. And this is a photo where Shri Gadgil ji invited us to Delhi to discuss and showcase about this technology so that the government can take this up and take it across to the farmers over the whole nation and try to change and improve the farming methodology in this nation. So with that, I would like to end. Thank you very much, Rajashri. I have hundreds of more things that I can share, but thank you so much.
Well, the landscape of your vision, your father's vision to now your vision and Rahul's vision is going to expand multifold. And I'm sure the hydroponics is also going to be a paradigm which, you know, you're going to change in this country. But thank you so much for sharing all these details. And reason why we have you here, because you are at the backbone of things, and we do not realize that when we are using the kits and the tests, who are the ones who are really actually working technically at the background to make them and make them available. We are so proud to have you with us. And on this note, I would again request Dr. Upre and to say a few words. It's of course completely, different, I would say, industry, but I'm sure you'll appreciate why and what they have been doing amazingly. And I'm so happy that they are my classmates and my schoolmates. Once again, I want to say that uh, on the media here. But over to you, Dr. Uttare, sir.
Yeah, thank you, Rajeshri. I think I've had one of my best times hearing and seeing what Dr. Varke has presented, because a lot of things are new for us also, though I have been in the field of medicine for so many decades. And let me tell you, Dr. Varke, both Rahul and Vishal, uh, basically, you all are the unsung heroes during this pandemic. So, the doctors have always been appreciated for their work, no doubt, because they are the frontline workers. But without you at the back office that we call, as far as the medical fraternity is concerned, it would be just like, the soldiers on the front line without the armament industry working. So if you don't have these weapons, I don't think we would have been at all able to handle this pandemic so well in India. Not only that, what you have presented, I think, forget being a doctor, but even as an Indian, I feel very, very proud that you have brought the India in the forefront as far as your microbiology and media and etc. Whatever, I think what you have told us must be just 10% of what you're actually doing. But then that itself has been so huge, and I'm very thankful, because I've been also hearing, I've heard this for the first time, what work you all have been doing, and congratulations there. And I think it would be a privilege if sometime I can definitely visit your factory or whatever it is to see exactly what work you all have been doing, because that has not come on the forefront as far as the medical community is concerned, and it requires to come, as I said, that the future of our working is going to be a teamwork, and you're a huge cog in that wheel of whatever is going to come in the future. So again, congratulations, and convey our congratulations to your father also, your uncle, who started this project, and both of you are taking ahead this project. And let me tell you, India and the whole medical community, we owe a lot to what you all have been doing. And thank you for being there for all of us. Thank you, and congratulations on this award.
Thank you very much, sir, for your kind words of appreciation. And our intent is only to raise this great nation. India was the largest economy on the planet for 2000 years. We were 30 to 40% of the global economy, and China was the second country. And when the British reduced us to shambles, so my father, while growing up, so he always used to teach us about Lord Krishna and Shivaji Maharaj. So how he draws his inspiration from these two heroes. And we have had opportunities to sell our company for thousands of crores. But ठाण्यात राहणारे आम्ही महाराष्ट्रीयन लोक आहोत, आणि भाजी भाकरी खाऊन, चटणी भाकरी खाऊन रात्री झोपी जातो.
Amazing.
आम्हाला काही जास्त त्याच्यात नको आहे, पण एक सॅटिस्फॅक्शन की आपण देशासाठी काहीतरी करावं, हीच एक जिद्द आहे, बाकी काहीच नाही. थँक्यू व्हेरी मच सर.
थँक्यू.
Thank you so much for both of you to be for being here, and Dr. Uttare sir, your kind words are really making the difference. I'm glad that what I've tried to do here, you've just resonated with your words. Thank you so much, and we would have to, with paucity of time, move to the next award, of course, and we are very, very proud for another hidden gem, but who has made sure that the world knows about him. And Dr. Uttare has also been a part of the mission. And of course, it's absolute pride, I would say, to introduce him. The RSG Excellence Award in Patient Care going to Dr. Anil Pachnikar. And how and where should I really start introducing him? He's practicing as a family physician since the last 35 years, and we know where. So he was appointed on the Jaslok Hospital Transplant Committee. He's been the National Vice President of IMA Headquarters, Delhi, 2019, Fellow of College of General Practitioners, FCGP, President of IMA Maharashtra State, 2012-2013, Director, CGP of IMA Maharashtra State, from 2010 to 2012, president of IMA Mumbai branch for 2 consecutive years from 2007 to 2009, and one of which 2008 to 2009 he was elected unopposed as the president of IMA Mumbai branch, and he's been winner of the Best President Award from the National Awards Committee. He's been organizing secretary of the Maha Arogya Mela conducted by Central Health Ministry, organizing secretary for 15 consecutive years of medical camps for Mumbai police personnel, 2000, 2000 and 2001 president Mahim Dharavi Medical Practitioner Association, which I know he's very passionate about. 2001 to 2019, he's been the scientific coordinator with the association, and he's been coordinator for the national program Clinton Foundation of HIV/AIDS, and of course, the biggest honor which he is well known today for, the key executor of COVID Warriors Dharavi pattern, with of course Dr. Shiv Kumar Uttore also with him. But few more things I would want to add about this person here is from where he started in a very humble background, just as Dr. Vishal Varke was expressing earlier, just the same, started from a very modest background, and he's become the national vice president of IMA, and he today is known worldwide for what he has done. He's extremely compassionate, and he cares about his patients more than anything. And allow me to share a few pictures. These pictures not everyone probably knows about, so that's why they have to be shared. Again, people who are in the medical fraternity of course know about this, but I learned from him that this has also been on the Washington Post. So these are the of course, he was recognized, he was given the award by the governor and so many other dignitaries, but this is the work that he has done door to door, and the way he has led this campaign, the compassion, the care, the leadership, I would say, has really, really transformed Dharavi into, as he says, is now ground zero with zero positive COVID patients. So on that note, I would really pass the baton on to him to speak about all the great work he has been doing since the last year. And since day one, he has not, he never stopped his practice, even when COVID came, first wave, second wave, nothing matters to him. Dr. Anil Pasnikar, it is absolutely a pleasure, and for two reasons. One, of course, all that you have done, and second, the kind of relationship you and of course Dr. Uture shared with my father, and I have learned so much about it from both of you. So over to you, Dr. Pasnikar.
Thank you, Rajeshri. I'm speechless for your kind words and all. It's really a great occasion today that RS Gadgil's 75th birth anniversary function is going on, and I'm getting the award of the RSG Wisdom and Excellence Award. We are indebted disciple of the Mr. R.S. Gadgil, who was a visionary, very kind-hearted, very beloved personality. I don't think that anyone has gone to him for any help has gone empty-handed. His zest and enthusiasm for the life I inherit. I think I love it. That the thing is that just go all out, not to worry. God is great to take care of you. So I love that person, Sir Gadgil sir, because of our habits of the foodie and music and dance, and we all used to mingle with each other just like a father and son. So I really cherish his memories all the time, all the way. And needless to say, Rajesh, you are not less than anything else. You are depicting him in toto, I will say like that, in all the functions and all the activities, and the way you have dedicated yourself for the betterment of the medical fraternity. Just you now known in each and every family. Right now, my daughter-in-law just watching this program, he said, Papa, I know this madam. She's always there in the IMS functions and all. Just see, you are just like our family member in our houses. So nice of you, dear. Thank you very much. In fact, RS Gadgil Award has been given for the Dharavi COVID model. In fact, you are rightly saying, Shri, this Dharavi COVID model is a brainchild of myself and Dr. Utture sirs. It has been started as the Rahul Shewal, the member of parliament, reached to my clinic and he said, Partner sir, Dharavi Shadi Kaidri Karais hai. And then I immediately contacted by Guru, Dr. Shukar Utture sir, that we have to do the project for the Dharavi. He came and then we had a meeting with the Mr. Kiran Digaukar, then BMC Municipal, Assistant Municipal Commissioner of the G North Ward. And we decided that we will do the door-to-door survey of Dharavi. Means why this Dharavi code model is well known and because everybody is appreciating, because till date the Dharavi was supposed to be the topic to tease, to topic to undermine, to topic to neglect and all. And what the people of the Dharavi, what the people of the doctors has done is absolutely astonishing, that the world has taken the cognizance of the things, that the better area can't do it, but the Dharavi doctors will decide, and the people of the Dharavi, the layman people. Because if you take the geographical area of the Dharavi, Dharavi has spread across the 2.5 kilometers with the population of 9 to 10 lakhs people, as good as the New York City. And all these are the low socioeconomic people, layman people. But one thing is that in Dharavi, you will find no one is a disturb or in depression. Every house, the industry is going on. Some or the other works they do day-to-day, daily basis, and they earn their dal roti. So one thing is that in Dharavi, nobody is, everyone is a businessman, a business-minded personality. The thing is that here when the Corona was going on, lots of fear was there, lots of stress and strain was going on. Nobody was to know what to do and all on to do what to do. At that time, Mr. Rahul Shewal, the member of parliament, our team of Mahendra Medical Doctors, Practitioner Doctors Association, Dr. Utture sir, myself, and BMC, Mr. Kiran Digaukar, we decided to do the door-to-door survey. Here I will put this Dharavi code model in a 3 part. First part is the door-to-door survey. Second part is the arrangement made by the BMC. And third part is the public awareness programs. On 3 sutri kalmavarti hai sir, puna Dharavi code model avalambuna hai. The thing is that when on the first death happened in Dharavi, in Baliganagar, on the 3rd of the April, the whole country has taken back. The thing is that just see, if Dharavi is a thickly populated area, Corona is a nosocomial infection. If it will spread, the India thought that Dharavi just like the Anubomb, it will burst the whole Mumbai, Maharashtra, and whole country. Because in Dharavi is a cosmopolitan, absolutely city. Because from the each and every nooks and corners of the India, all the people are settled in the Dharavi. So Dharavi is a true picture of the India. That here you will get the people from the Arunachal Pradesh to the Kerala, Karnataka, to the Delhi, to the Hyderabad, to the Mumbai, Gujarat, everywhere people are coming from Dharavi. So when we started sitting with the BMC and member of parliament, Rahul Shewal, we decided to select the 5 hotspots in the Dharavi, where the maximum number of patients were there. So that area where the Muslim Nagar, Madina Nagar, Social Nagar, Mukund Nagar, and the Kalyanwadi Vaibhav Nagar. In the 8 days, we done the survey of 43,800 people. Out of that 43,800 people, we sent 4,000 people for the quarantine, 443 people for the lab testings, and we found 20% patients positive after the lab testings. And here we taken the information from the people that after going door-to-door survey, when everything was under the lockdown, everyone is fearing for his life. Nobody wanted to risk their life. Everyone wanted to sit idle in their house. At that time, we doctors moving door to door in the Dharavi. asking the people, anybody is having cough, cold, fever, anybody has the history of the travel from the Andhra or Karnataka or anywhere or from the abroad, or anybody has come in contact with the corona positive patients. Friends, I will let you know that people after seeing the local doctor, I'm practicing Dharavi from last now 36 years. People after seeing me, they started crying that this man is coming to our house to save our house, to save our family, risking his own life and risking his own family. The thing is that, and they got open up, which what information they have given to us, they would have not given it to the BMC or to the state government doctors. And then we got all the information about the people, who are the positive cases, where whom to send and all. Can you imagine in the first phase itself, 20% people infected, people who were isolated, and the people around them we quarantine, and we saved the Dharavi. If this would have burst, what would have happened? Can't imagine. In fact, then at that time, then the municipal commissioner, Mr. Praveen Pardeshi, has narrated this history to our chief minister, Uddhavji Thackeray sir, and Uddhavji Thackeray sir in the video conferencing openly appreciated Dr. Anil Paschal and Dr. Shivkumar Uttare sir, that what kind of work they have done in Dharavi is really appreciable and is really praiseworthy. And Uddhavji Thackeray sir has said that I have conveyed this message to our Prime Minister, Mr. Narendra Modi ji sir also, and Narendra Modi ji said that this Dharavi pattern of door-to-door survey by the local doctors should not get limited to the Dharavi only, but it should be spread across the Mumbai, Maharashtra, and all over the country. And Modi ji has said that this pattern they have conveyed to the WHO, World Health Organization, and World Health Organization has taken the cognizance of this Dharavi COVID model and appreciated it wholeheartedly. So the thing is that just see how the things happens if you start small things for the people. In the second phase, when it was a hot, humid condition, what BMC people started falling, because just see in the PPE kit to move from the 9 o'clock to the 5 o'clock without a sip of water or without the urination facilities, it has started taking the toll of the BMC staff also, and they started fainting down. So Praveen Pardeshi said that all doctors should open their clinic. He has taken out the whip. At that time, the whip, he said that the fever patients should be, forwarded to the BMC hospitals only. No doctor should see the fever patients. At the time, we put our foot down. We said, sir, for your kind of information, 30% of the healthcare system is taken care of only by the state government and the BMC, and 70% healthcare system is taken care of by the private practitioners. If you say all the fever patients should be forwarded to the BMC and state government hospitals, then they will collapse because of the 100% burden. At the same time, what information the people will like to give to their private doctors, they will not be able to give it to the state government or the BMC doctors and all, for the fear that they will do something for them and all. They have the faith on the private doctors that private doctors will take care of our problems and will give us the way solution for it. Sir has Praveen Pardeshi sir has agreed, and they allowed us to have to see the fewer patient. Same thing has happened for the blood investigations also. For the nosocomial test also, RT-PCR test also. Previously they said that only BMC people, doctors are allowed to send for the RT-PCR, and then when we force that, when patients are coming to us, if you don't have faith on us, why we should see the patients and all? Then he said yes, go. And because of this, just see, because of when we have got the facilities from the BMC to go for the RT-PCR test, we have got the government facilities to see the patients. We have got the government's grade note to send the patients for the isolations, for the quarantine. Because when people used to come to us, we used to always tell them, just see your cough, cold, fever, all the symptoms seems like things that looks like to be the COVID positive, go for the testing. And they used to listen, people used to listen. And then we used to tell them that you are positive, go for the isolation. And people around you send for the quarantine. Because all these facilities of the quarantine, isolations, your food, medicine will be taken care of by the government. So that by this way, you will be able to save yourself, you will be able to save your family patients also. By this way, it has a great activity was happening. That BMCs were helping us by giving us the PPE kit. sanitizing our clinics and all, and we are going to the people, letting them know what is these things and how to take care of it. So it was a conglomeration. At the same time, BMC has organized a very proper quarantine centers in Dharavi. Then they have organized a proper isolation hospitals in Dharavi, Sai Hospital, 51 bedded. So the help of the BMC was also over there. State government was also over there with the help of the local doctors. Now the third part is more important, that the public awareness programs. Here the public awareness program was that in Dharavi, now lots of towers are there, but just see, still the 60-70% people are staying into the slums, into the small houses. In one house there are 10 to 12 people are staying, 10 to 15 people are staying in 10 by 10 rooms. The thing is that they don't have the toilets, and we given a thought for it that the major spread will be there from these toilets, because when people there are 45 toilets in Dharavi, each toilet is having 10 to 15 rooms, and each toilet is used by around about 1,500 to 1,600 people per day. So the chances was more rampant of spread of COVID from these toilets and all. So with the help of the BMC and the fire brigades, we kept the toilet soap and water out of each toilet. So before going to the toilet, people used to wash their hands and legs. Then they used to go toilet. After coming from toilet, they used to wash wash their hands and legs with the soap, and they used to go home. And after each defecations, BMC and fire brigade used to sanitize the toilets and all. By this way, we got the major breakhold to stop this corona. Friends, the thing is that the major public awareness programs from we implemented from our clinic, from the BMC, from the police, by posters, by public awareness systems and all. We used to, these people are lay, but these people are very polite and humble. We used to tell them how this corona spread, why you should wear the mask because it's nosocomial infection, why you should keep the social distance because virus can't run more than 1 meter, fly more than 1 meter, why we should wash the hands because it sticks to your hands, and if same hands will use to your nose and eyes, you will get the infection. Why to use the sanitizations and all, because you will to kill the virus. Here we used to tell them that do gargling with the salt, drink hot water, then do the brushing twice a day, eat the hot food only, don't eat the outside food and all. We used to tell them that whatever your do daily Surya Namaskar or Baithaka or the yoga and all. The lots of depressions and things were happening like that. It started taking the toll because of the immobility, because of the not proper contacts with the friends and the relatives and all. People started showing the signs of depression. So we should tell them, you take the interest in your area of activity, dancing or karaoke or by playing the games and all, and talk to your near and dear relatives. So this has really helped people to feel them good and all. At the end, I would like to say what this Dharavi Corona model. This is the conglomerative effects of the local helping hand by the local people, the BMC and state governments great helping hand, the simultaneous work done by the police departments to keep the peace and to keep the law and order, but over and above the major help given by the private medical practitioners, risking their own life, risking their own family to serve the society, nations trustworthily. Thank you very much. Thanks a lot.
Well, mesmerized completely. And it is something which, of course, everyone has so much learned from. But this talk will be, incomplete if Dr. Uture is not going to add to this whole thing. So I don't know. I have extreme high regards for both of you, and of course the warmth that you shared with Dad and you share with me also, and the way you have been encouraging me and supporting me, and you have been doing that to endless people. So, Dr. Uture sir, Please share your inputs and insights when you both did this magnanimous and mega task, which the whole world needs to learn from.
Uttareshwar was all the time. Just see, I am practicing in Dharavi from the last 36 years. Uttar is practicing in the elite area of the Shivaji Park and Mayam and all. But the thing is that he was moving along with me in the every gullies and corners in the Dharavi, along with me shoulder to shoulder. Hats off to him. He has that courage and the passion to work for the downtrodden people of Dharavi. Hats off to you, sir.
Yeah, thank you, Rajeshri. Now, what do I talk of this person? I have known him right from his college days as a student, where I was his senior, and today he is my colleague. And I have seen his exponential rise as a professional, but also as a human being. And that is something that should be really appreciated. And let me tell you, as far as this Dharavi project is concerned, you require a daredevil like Anil to really, do this project. And lovingly, all of us in the medical field, especially in IMA and in Maim Dharavi Medical Practitioners Association, we call him as the Dawn of Dharavi. So because because purely because of his basic personality and attitude, where nothing seems to scare him. And why I'm telling you this, let me tell you, is because see, you have to go back to 2020 April. In the beginning of 2020 April, if you see, even the so-called intensivists and the infection, MD infection control, people who were working in the hospitals were scared to enter the hospitals. And even if, they were entering the hospitals, which was in all that PPE kits and, taking full precautions and going there. And here was one person who dared to enter Dharavi, though he says he's been practicing in Dharavi. But you have to remember that in April 2020, the whole medical community was also extremely scared of this disease. And we were finding in that, April, May, June, if you find out the statistics, the number of doctors who succumbed to COVID has been extremely high. And at that time, to enter these small bylanes, and if you have to see Dharavi to really know what Dharavi is, where those bylanes are hardly 2 feet, 2.5 feet, the houses facing each other. And when you enter those bylanes and you cross, and if someone is coming from in front of you, both of you have to turn sideways so that you can cross each other. So that is the situation of Dharavi. And in that situation, for the first time ever in India, to do door to door, checking of every patient. And he spoke about the numbers. The numbers were almost 49,000 that we did. Not only that, motivation of those 25 doctors who entered this field, who were sitting at home at that time, even you have to credit it to this person because he could motivate those doctors, and those doctors entered Dharavi along with him for the first time. And what has happened is, when these 25 doctors entered along with the BMC staff into Dharavi, and that spread everywhere. There are more than 350 clinics in Dharavi, and all of them were shut. And I think, if I'm not mistaken, only 2 or 3 clinics, out of which one is Dr. Anil Pashnekar's clinic, which never shut even one day. One day, the doors were never shut over there, even right from the beginning of the pandemic. So, the other doctors also got motivated, and that is the reason why we could control this Dharavi. And this was famously known as the Dharavi project everywhere, which got mentioned even by WHO, ICMR, and was reported in Washington Post and New York Times also. And that was replicated in the other slums all over this. So I think this person deserves all the accolades, deserves all the awards. Of course, we found that after a few months, there were other people who came forward in Dharavi and tried to project as if like that project was done by them. But come April, there were very few people. Of course, credit has to be given to the BMC also. They worked with us shoulder to shoulder. Even their staff came down on the road with us in Dharavi. But as I always say, that in a medical field, the captain of the ship is always the doctor, and he has to lead, and only when he leads, the others will follow. And I think that is what Anil has done in Dharavi, and that whole project has been purely successful because of that step taken by him and the team in beginning of April. And because we caught this pandemic in its initial phase, if you remember at that phase, getting RT-PCR test was also extremely difficult because all the kits were imported. Now, of course, we have to thank people like Dr. Varke for getting it to us so easily where it is available now. But at that time, getting it was very, very difficult. And at that time, to clinically examine the patient by going to his house and coming face to face with that patient was something which a daredevil can only do. And this award that you have given him, forget he being a personal friend of Gadgil sir and everything, but he deserves this award, and he has received a lot of awards for his daredevilry. And I think he is even gone on that TV show. Which one was that?
Khatro Ke Khiladi.
Khatro Ke Khiladi, where he was specially invited in that Khatro Ke Khiladi for not being a khiladi in the TV show, but being the khiladi on the ground level itself, and facing this khatra. So kudos to you, Anil, and kudos to your whole team, and congratulations, Rajeshri, for having taken him for the award function. And we hope, Anil, and I think I don't know if I should mention it or not, but you have to understand that Anil has got his 2 children who are with transplant. In spite of that, having this problem at home also, I think what he has done is very, very commendable, because every day the scare of taking this disease home and his to his children was always there. So you have to grant that to him, that even on a personal level he has really been a khatro ke khiladi, and he has overcome all the fears of this COVID and led the whole team to bring out this Dharavi model. So thank you very much. Instead of he saying thank you to you, I thank you, Rajeshri, for giving him this award. Thank you.
All your blessings, with all your blessings.
This frame right now is something I am going to capture in my heart and brain, and a lot of us are going to. This means a lot, and of course, at my background, we do have RSG as well. So this is
and he's watching us.
Yes. I have no words. I don't know. I just don't know what to say. I have tears in my eyes. And when Dr. Pasnekar started off only, because I know how compassionate it is. And Dr. Utture, thank you for mentioning his personal side, because not many know what how bravely he has battled this, and for whom, when people feel that doctors don't do anything, or he's an example. He has set that example by being the leader. People have in Dharavi actually stayed safe because he led them with his care and compassion, with respect. They've actually followed it, and I guess that is the major reason why Dharavi never flared up. And that is something which we probably don't realize when we say the model, but the man behind the model. And Dr. Utture, sir, you have supported him.
Yes, always,
yes.
throughout my life.
Relentlessly. So, I mean, kudos to Dr. Anil Pasnekar and you as a duo. And our best of the wishes for all that you are doing for all of us. What we are seeing today is not even 0.1% of what you have been doing. But and thank you, Dr. Utture, for resonating it in right words and expressing it. I want to move to the next award, but I still don't want to move out of this frame. What to do?
Incidentally, Rajeshri, I would like to mention over here that for the past couple of days, Dharavi has got 0 COVID cases.
Absolutely, and it is unbelievable. It's absolutely unbelievable. Well, great. On that note, we will have to move on to the next award. Another, we started with the big hospitals, the corporate hospitals then, and we have actually chosen two hospitals which are probably smaller in size, but Sushruth Hospital is again not small in size, but in Nagpur. And I take the proud privilege to announce the RSG Excellence Award in Patient Care to Sushruth Hospital, which is in Nagpur. And of course, it is led by Dr. Sushruth Babulkar. And I do not want to, I want to do the honors, but yet I want to invite someone special to Dr. Sushruth Babulkar, and that is Dr. Amit Asgaonkar, who is one of his very dear friends. I want him to do the honors of introducing him. And Dr. Asgaonkar, really over to you. And I can actually share the screen if you like.
Yeah, thank you, Rajeshri. It's an excellent occasion actually, because Gadgil sir we used to know since so many years, and he has helped us in orthopedics. He has helped everyone, but for me as orthopedics and doing conferences all over the country, Gadgil sir never used to say no. As Dr. Pachanekar has said, everyone has been telling. Such a big heart he had. And I remember he used to call us, me, Sushruth, and our other friend, Dr. Sunil Kulkarni. And we used to sit together. He had big things written for us, unfortunately. We miss him a lot. And he passed away early. That is what I could say. He had a lot to do in his life, which of course you would be taking over and doing it later. Now, regarding my dear friend Sushruth Babulkar, though I am sitting here in Mumbai, I am in Malad, but Sushruth, being there in Nagpur, has done such a lot of work in COVID. We both are orthopedic surgeons, and Sushruth, I'll tell you, he is one of the leading orthopedic surgeons in India and the world, I'll tell you. Presently, he is the president of our Trauma Society, the Trauma Society of India. He is a founder member of the International Orthopedic Trauma Association. The International Orthopedic Trauma Association is the director of his own hospital, MS Orthopedics, MCH Orthopedics. He has done a lot of fellowships abroad. And if I go on reading his profile, it will take a very long time. But Sushruth, being such a dear friend, I know him since so many years. We have been working together in numerous meetings, conferences, and the way he has his energy. Today, I can see a different Sushruth. He has lost a lot of weight probably. And he has been very active in the academic front in orthopedics. He has been always very hardworking. And in the same way, he has dedicated himself towards COVID too. That is what I feel. Even I know I have also been doing COVID work in my own hospital. Of course, not me, myself, my physicians, everyone. But the way Sushruth has been there, Sushruth didn't have time for the webinars which we had in orthopedics, and he has been completely devoted to orthopedics, despite he has had numerous health issues also. And yet he has taken over as the leading COVID center, as a leading COVID hospital in Nagpur, when Nagpur had so many cases in April, May, this is the second wave. And I think after Pune, Nagpur was the highest number of cases in Maharashtra, probably in India also. And that is Sushruth Babulkar. Wherever he goes, he is hardworking and is devoted to his work. He does everything to his heart and with all his hard work and his talent. He gets up, and he has literally treated more than 2,000 people in Nagpur in his own hospital with around 94% of success rates. So there it's Sushruth Babulkar for his COVID treatment. Rajeshri, you can take over.
Sure. Courage, commitment, and a lot of medical, algorithms that he worked on. And I can like you said, we can go on and on to speak about him. I did actually do a special episode on him and his work as well, because like you rightly said, when Nagpur was completely on fire, that is the time this man decided to get even more stronger. and what he has dealt with, I'm sure he's going to share with us. And though, sometimes we have the privilege of having larger setups, but he having a setup which is neither too large, neither too small, and how he transitioned from just an orthopedic hospital to actually being a COVID care hospital. Dr. Babulkar, over to you, really. Otherwise, we both will just keep going on and on about you.
Thank you very much. Thanks, Amit, for all your kind words. Of course, एक मित्र दुसऱ्या मित्राबद्दल चांगलंच म्हणणार. Thank you, Rajeshri, for getting me over and for awarding us with this honor. 18-19 March, when me and my family last year were at my resort in Tamia, and that's when Mumbai was already affected and the wave was to come to Nagpur. That's before the first wave. Then I discussed with my family and I told them that I wish to start COVID services and I wish to close down orthopedics for a while and let us devote ourselves to this cause, because this is once in a lifetime opportunity any doctor can get to serve the society, and it's like a war situation. My family immediately agreed. My parents supported me, my wife, my daughter supported me in this cause. And on 21st of March, ours was the first hospital which jumped into this fire of COVID services. I wrote to Nagpur Municipal Corporation and I let them know about our desire to come out with dedicated COVID hospital wherein patients can come and get treated. My next difficulty was, how do I do it? Being an orthopedic surgeon, a die-hard orthopedic surgeon, not trained to deal with COVID situation or like a physician treating with other elements. Orthopedic surgeons are orthopedic surgeons. So I formed a ring around me, led by my friend physician Dr. Anand Kate, other intensivists who were with me, Dr. Mahesh Sarda, my residents who supported in this cause. The next difficulty then was even the hospital staff was scared to kind of work and deal with this situation because they had their families at home, and anybody would get scared to work day long in a COVID hospital and contaminate their families once they go back home. But once I declared and decided that I am going to leave my house, wherein my parents being senior citizens will be there, confined to home, and my wife Dandini to look after them, I decided I will leave my home and migrate myself to hospital. Every staff, all the staff, not even a single left out, and supported me and told me that, okay, we will stay with you in the hospital all the time. So they took turns weekly. I was staying all the time in the hospital for those 3.5 months. In the first wave, then some interim time, and again in the second wave. So I was blessed to have the family and the hospital staff to be by my side. Of course, the team of experts supporting me in treatment, and we saved so many lives. I have so many stories to tell, some gratifying, some terrifying, but we achieved what we wanted to towards the service of humanity. And I deeply appreciate Rajeshri for identifying this, for knowing this and appreciating this in the form of this award. I, on behalf of my family, of Sushruth Hospital and my personal family, thank you very much for organizing this and awarding us this honor. Thank you.
It's absolutely an honor, Dr. Sushil Kavalkar, for us, and a lot many know that your father is also a legendary orthopedic surgeon, and your family has already contributed and treated numerous patients and given them such great patient care. And what a noble way to completely keep your orthopedic practice aside and jump into something which probably could have turned out to be a nightmare, but turning it into a great service to the people and patients in Nagpur. It's absolutely an honor, and I would actually invite Dr. Utture sir to present the award, but I also want to specially mention Dr. Amit Asgaonkar here, because he comes out to be a completely cool guy, but when it comes to courage and his commitment to work, he's absolutely amazing, and he has equally done a great service in these time. Many thousands of, I think, patients of COVID that his hospital has treated, also Zenith Hospital. So though we haven't been able to present you the award, we definitely recognize and admire and appreciate your efforts. We of course personally have the what do you say, the experience of you as a surgeon. But on that note, I will just pass the baton on to, and I would request Dr. Utture rather to present the award and say a few words.
Yeah, thank you, Rajeshri. I think the surname Babulkar in medical fraternity is a huge name. And right from his father's time, of course, I have no direct contact with Dr. Shushru, but then that name has always been there in all our minds. And I think that's a great family that we have to appreciate. And what you have to appreciate over here is that, right in the beginning also, during the first wave, when I was interacting with the authorities in the government and all, and, in the council, we have got all the details of every doctor. And they were trying to count the number of physicians, number of intensivists, and then always there was a hue and cry that we are going to fall short of people who will be working. And what you have to grant is that people like Dr. Babulkar, where I don't think even remotely he is in any relation with treating COVID, because as surgeons, I know I am also a surgeon, that whenever it comes to any medical problem, we just say refer to so and so, and then we forget about it. But then people like him who have come forward, I think that has been the basic beauty of why we could control this disease, especially in Maharashtra, which was hit the highest amongst all the states in the whole of India. That every one of us have contributed. And just now you said that about Dr. Amit, that I could not give him an award. Rajeshri, if you think of giving awards to everybody, it would be a session of more than a week or a month. That is the number of people who have really worked during this COVID times. And let me tell you, that has been the beauty of the medical profession also. Unlike any other profession, where you found that all the other professionals sat at home, protecting themselves and their family. And this was the only profession which came down on the road, which worked actively. And though there was a fear, let me tell you, we are also human beings. I think Dr. Babulkar will also agree to what I am saying, that there was always a fear at the back of our mind. And that is what made him also shift from his residence to his hospital, where many doctors have done that. They have shifted and, stayed away from their family for months. And I'll tell you, this can be seen only in the medical profession. Whatever today the world talks about us, we are seeing so many negative things also coming. But I don't think that any other profession has given to the society willingly and contributed without thinking about the returns what the medical profession has done. And I think Dr. Babulkar and Dr. Amit are the epitome of this, to show us that though being specialists in different field, they have completely, आपण म्हणतो ना, वाहून जातो आपण, कुठल्या तरी when we take up any issue, they have done that. And I must congratulate both of them, and congratulations, Dr. Babulkar, for having won this award. If I'm not mistaken, even MMC has given your father the awards last, in my last term when we were there, and you all deserve these awards. So congratulations again, once again. Thank you.
Great. Again, thank you again, Dr. Sushil Babulkar and Dr. Amit Asgaonkar for being with us today, and Dr. Babulkar for receiving the award. On behalf of course, you and your team, the excellent work that you have done. We will now move forward to the next award. And just as Dr. Uturi said that, if we start giving awards, we can give awards for months. We never know, we might, TRUWELLTH might decide to actually at least recognize the efforts. And that's what we have been doing for the last whole year, trying to recognize the efforts of the medical practitioners, trying to create the right image of what's going at the backdrop, at the background, the work that doctors have been doing. We have been doing this really relentlessly. And while we are doing that, one more hospital which we tried to showcase a couple of months ago for the work they did in vaccination. And these were the times when people were extremely skeptical if we should get a vaccine or we shouldn't. And I remember when I visited their hospital for my mom's vaccination, and the way they were organized. Again, a surgical hospital, a hospital where Dr. Suradkar practices diabetology, was completely converted into a vaccination center, so well managed, and which is why I feel and we feel that they should be recognized with this RSG Excellence Award in Patient Care. To introduce and speak a little bit about Highway Hospital, which is led by Dr. Suradkar. I would say Dr. Suradkar and Dr. Kalpana Suradkar and Dr. Shekhar Suradkar and their team. Highway Hospital was established with the purpose of serving the community with the ultra-modern medical facilities at very reasonable rates. Their staff is very well trained, cooperative, empathetic, and always helpful in providing treatment and service to their patients. They've received the Wellness Icon Award recently in the presence of Honorable Ministers Eknath Shinde, also Girish Mahajan and Aditi Govishkar by the Lokmat Parivar. The CEO and Managing Director, Dr. Kalpana Suradkar, is MD Medicine, DCH, PG, DBM as well. She's done a management, and which is what we are going to learn from her talk today, how she used her management skills as well, in addition to her medicine skills, in transitioning into the vaccination center. She has special interest, of course, in diabetology and critical care, and she has 28 years of experience, especially handling critical and complicated cases. I would say a lady who will not speak or will not boast of what all she has done, but she's been organizing secretary with several conferences, and she has ably managed all of them. Of course, Dr. Shekhar Suradkar, he's a well-renowned surgeon, and he's been part of many associations as president, secretary, and he has done great work for academics as well as I mentioned, he's a great surgeon as well. He's the chairman and chief of surgery at the Highway Hospital. And I would definitely want to mention his son, Dr. Kunal Suradkar. He's also a surgeon with global experience, of course, and has done relentless work through COVID from day one. He has been at the forefront, treating helping COVID patients, treating them, and of course then keeping up with the surgery at the JJ Hospital. And I would now, of course, invite the Suradkar family to receive the award, and of course, before that, share their experience and all they have been doing through this pandemic. Uh, they are my favorite people, if I can really candidly say, on the via the whatever the global media, but they are just great human beings. They have done a lot in Rotary service. But over to you to tell us all and inspire us, and with all the simple and big things that you have done. Over to you, Dr. Kalpana Sudhakar and Dr. Shekhar Sudhakar.
Thank you, Rajeshri, for making us part of this event. And before Kalpana speaks something about our venture into this vaccination program, I would like to just say something about Mr. R.S. Gadgil, who was my very dear and very close friend. We have been associated since last 2 decades before his death. And I'm very happy to say that wherever Mr. Gadgil, whatever he touched, it turned into gold. He was a very magnificent, magnanimous, and majestic person. Wherever he used to enter any room, he used to just magnify. He used to, like a magnet, he used to attract the people. His personality was so magnificent that he used to attract people from all walks of life. Although we were doctors, we keep and pharma people little away. We don't let them intermingle with us. But to many doctors, he was just like a family friend. And Gadgils have been our very close family friends. Minal Gadgil, your mummy, and Shri, they have been doing great work after the death of Mr. Gadgil. Regarding his involvement, especially in Thane, I would like to say that Thane was sort of little inactive before we took up. Dr. Tambe was the president and I was the secretary. And when we had a brainstorming session, how to involve all the members, there are more than 500 to 1,000 doctors, but no one was taking an active part. So we devised a strategy to bring something like all doctors on one platform. We created a musical society. We created a quarterly magazine. We started monthly CMEs with dinner and all those things. We started monsoon picnics. So all those people who were not involved in IMA became member of national headquarters also. And Mr. Gadgil is to stand like a rock behind us. The Diwali Dhamaka, which we organized, where more than 50 doctors participated in that musical event. And it was one of the grandest show. 500, and it was attended by 500 people. And we felicited many people in that program. Even Dr. Uttur is there, he knows my involvement with colorectal society. When I organized the basic instructional course, before that hardly 40 to 50 people used to attend. But we printed 25,000 and he was the one person who supported all these ventures. And we could attend, that was attended by so many number of people. And after that, it never looked back. And it ultimately culminated into me becoming the president of the ACRSI. Not only that, but he was involved in our GI surgeons platform. So many of his our CMEs were supported by him. When we organized the Asian Federation of Coloproctology, one of the first international event, there also his involvement was magnificent. And whenever he used to be there, we used to feel very comfortable. We used to know that this will be a grand success. Mr. Gadgil was another name of success. He used to say, failure is not a crime. Not making an attempt is a crime. And we tried and did many conferences along with him. We started one day IMA IMA conference, local Thane branch conference. And it used to be so hit. We do, of course, and very popular event. Still we are doing all those. Dr. Anil Pasnekar as the president, IMA, Master State, and this he also attended many of our functions. So he was a tremendous person and very majestic person. I don't get any other name. He was a majestic person. Actually, his loss was a great painful moment for me. This is what and regarding the vaccination, Kalpana is the one who conducted all those vaccination drives. So she will do say something about that, or to Kalpana.
First of all, thank you very much, Rajeshri, for this award. And such awards make us to work more and more. It encourages us to do more for people. We basically have a Rotary blood in us. We do a lot of social work through our organization, also through our hospital also. And this continued with our drive into one of the major vaccination drive in our hospital. Before that, when the lockdown started in March 2020, ours was a non-COVID hospital. And the thing is that the patients started coming to us, which we knew they were COVID, but then the reports were negative. So we had a lot of problems initially because the staff was not trained that time, and other patients who were admitted with them. So it was a challenge for us to separate them. And then it was difficult to talk to the relatives also, that because they were saying they are negative, so they are not COVID. So it was difficult to talk to them, and they were not accepting this situation. And then ultimately what happened, we had to stop our admission because 2-3 of our elective surgery patients also turned out to be positive. And then we literally stopped admissions. But what we had to continue was our dialysis center, where a lot of patients came from civil hospital, because civil was declared as a COVID hospital, and many patients came to us. And again, some of our technicians, they just left because the COVID patients were coming there. They thought the patients who are coming from civil must be COVID positive, so 2-3 of them just left. And then we were left with few technicians. Somehow we could manage to talk to them and manage to talk to their parents, because they were also not willing to send these technicians. And then somehow we managed to get them, and we actually worked overtime. And our dialysis used to start at 7 o'clock, and then it used to get ended at 1 o'clock. Somehow we managed all these cases, because for us, looking at those patients who were at risk of COVID, plus they also needed dialysis very regularly. So we supported them by doing their vaccine dialysis at night also. So this is how we could manage all that. Then after after the lockdown, that is this March, the good news was the vaccination was started. And ours was one of the hospital who was on the panel of vaccination drive. And again, it was a challenge for us, because it was some different kind of work, because we manage indoor patients and we have ICU, we manage operation theater. But then these staff was not trained, so I had to train them. Since I have a management background also, we could do that in a better way. And infrastructure, like my staff, Dr. Suradkar, and everybody contributed in all this. And we did a lot of infrastructural changes for this, because we had to have 2 observation rooms. We don't have a bigger hall where we can put all these patients after the vaccination. So we had to arrange 2-3 observation rooms. We had to arrange 2-3 vaccination rooms. And then getting these people the injection, giving injection was not a big problem for us. But the challenge was to get these patients, the crowd management, and the online support. Because initially the above 60 group, they were not registered online. So we had arranged a desk for them. So they used to come, we used to give them tokens, and then our people used to register them. And many times it used to happen, the senior citizen didn't have cell phones, or maybe they were not about, they had some old cell phones. So it was a challenge for us. So this team was working. We were actually on the first floor, but then we shifted all these staff on our ground floor, where we had erected one pendal to take care of all these people who are waiting. So their verification was done there, registration was done there. Then we had arranged staff who used to take these patients in the wheelchair, or sometimes they used to take them to our first floor hospital. And from there, all the staff were guiding them where to go and all that. Because this is not basically, this is a hospital, so here there are different rooms. So there were staff who were taking care of them. And I'm very happy to say that my staff actually got trained and they did a fantastic work. And every senior citizen who came there were very, very happy. We got very good feedback. And we also offered them water, tea, biscuits, because it was a hot season. So it was, they were standing or maybe sitting there for a few hours. So we had to do that hospitality for them. In the observation rooms, the staff was also trained. They used to tell them about the which are the medicines which they are supposed to take after, if they develop any body ache or any other side effect or fever, so what was to be given. Then they also trained them to download their certificates. Basically, when they're waiting for half an hour, that half an hour was not wasted. They were also clicking photographs there. So people were very happy, and we actually got very good reports from them. And the blessings the staff and we all of us got from them was it was tremendous for us. So that encouraged us to do a lot of more other things. Then the next challenge is, now since last 1 month we are in short supply of vaccine. So the challenge now is to procure more and more vaccine, and we will try to maximize our efforts and get all maximum possible people vaccinated. And this is going to be a challenge because of the rains also. And up till now we have done almost 14,000 vaccinations. In a day, maximum we have done is 600, and it was a havoc on that day because we had received a good quantity of vaccine, and somehow that messages got it got viral, and then lot of people came. So crowd management was a biggest thing we had to do. We got support from our friends also. We got some NGOs, Rotary, working with us. So a lot of people also tried to help us. So I thank all of them. Actually, I also thank my staff who helped me a lot, and because of them this was possible. So in future we are planning to have 2 to 3 vaccinations places, like workplaces we can go to. We are trying to do all that in a day so that maximum people get benefit out of it. And Rajashri, thank you very much for giving this award. And Mr. Gadgil was our family friend. Rajashri, her mother, we all were together being Thaneites. We all communicate every now and then. And you are carrying forward his legacy. I'm very happy that so much you are doing, and you're continuing his efforts. Whatever he used to do for medical fraternity, you're continuing that. I'm very happy. All the best for your company, and you follow his footsteps. All the best.
Thank you.
Thank you.
Thank you. Thank you so much. And I really wanted to bring this service aspect out while you speak. And that's really why this recognition. And while you're of course doing patient care and so much already, the service that you actually provided to the senior citizens is really amazing. And like you said, the blessings, they were tremendous. I've seen it with my own eyes. I've actually even recorded them. So it's excellent. And so I would really request Dr. Uttore to come forward, and yeah, we would like you to present the award virtually to Dr. Suradkar, Kalpana Suradkar, and Dr. Shekhar Suradkar.
Yeah, thank you, Rajeshri, and congratulations, Dr. Kalpana Madam, and my dear friend and colleague, Shekhar. We have been in contact for a very, very long time. And let me tell you, I think this is an apt award, and I must congratulate Rajeshri for giving this award to them, because just as we saw that the clinicians and the hospitals would play a big role in the first two, what we have aspects of COVID. In the third wave, it is going to be the vaccinators who are going to play a big, big role. And it is, we have understood even in the government level that it is going to be impossible for only the government entities to take over this vaccination because of the huge numbers that are involved. And this is where the private sector, which has come forward, and I must congratulate people like Dr. Suradkar, who have come forward, and that services that they are giving, because that is going to to some extent control the third wave which is going to come over there. And again, I would like to say that, we are a unique profession, the medical profession. We can change ourselves and change the way we think and we work from what we have been taught all these years. And this is, I think, what the Suradkar family has shown, where they could convert themselves from clinicians to managing the whole show and getting the hospital ready for all these things. I've seen the crowds that I've been to so many centers where the vaccination takes place. And let me tell you, it is impossible to control that crowd over there because everybody is so anxious and everybody wants to be the first one to go and get it done, which is not possible because everything takes time and there is a protocol to be followed. Very difficult to convince them, I think. And I think many thousands you have already vaccinated. So you're doing a great job. Let me again congratulate you for that. And as I said, the next era is going to be the era of vaccinators to really try to control this pandemic. So congratulations once more, both of you, for getting this award. And I would just say that please keep up the good work because only then we are going to achieve our target of controlling this pandemic. Thank you very much.
Thank you.
Thank you. Thank you.
I would like to
Thank you very much.
I would like to thank Dr. Suradkar, all three of you, though Nal's not here, but it's like thanking your own family, but for the amazing work that you have been doing. And Dr. Utturegi, thanks again for really appreciating and bringing to our notice that vaccination is really going to be the most important aspect we all need to focus on, right from the ones from common people to doctors and to the, of course, the hospital establishments. With that, of course, we go to the next award. The next award goes to, what a name, I would say, RSG Excellence Award Inpatient Care to Mumbai Dhadkan. The name says it all, really. And while the name says it all, these were 9 vital lifelines that beat as one Mumbai Dhadkan. And I would actually welcome Dr. Charuta Manke, Dr. Anjali Chabria, and Dr. Anjali Damania on the virtual stage. And who but to introduce them aptly, Dr. Louis Manke.
Good afternoon, everybody. It is my proud privilege to introduce Mumbai Dhadkan to you because my sister Charuta Manke is a big part of it. Mumbai Dhadkan is a group of socially inclined individuals and NGOs who have gotten together to ensure that we provide the right kind of assistance to frontline and healthcare workers and citizens by rationally utilizing resources. I became aware of this when the COVID situation started, and we were facing a lot of problems procuring things. I remember asking Charuta about how we can procure PPEs and sanitizers because we were getting a lot of dearth of these materials. And I wanted something for, we were all trying very hard, and I wanted something for Vaidya Hospital. And she said immediately, please call Anjali Damania, and she has currently, we are on this group, and she has this surplus and she can provide it. And it was so prompt. So I think they have it's exactly like a heartbeat because they have arteries and veins everywhere. So the moment somebody in Bombay feels that there is some shortage of something, Mumbai Dhadkan works very hard to provide these facilities. May it be facilities, may it be nutrition to frontline workers, may it be so many other things that they are working in so many directions. So let me introduce the everybody who makes Mumbai Dhadkan. Dr. Anjali Chabria is a Mumbai-based psychiatrist who has authored the book Death is Not the Answer. She founded the Golden Citizens Trust and is part of Mumbai Dhadkan. Dr. Sanjay Goel, who is a radiologist and now CEO, Sanvin Group and Chairman, PKC Hospital. Dr. Charuta Manke, my sister, who is the head of ophthalmology, HBT Medical College and Cooper Hospital. She's a comprehensive ophthalmic surgeon and faculty with 10 years experience, a certified NLP practitioner, trustee of Dr. Nitu Mandke Charitable Organization, and a founder member of Mumbai Dhadkan. Lion Chetan Shah, who's a past president and holding trustee, Lions Club, Juhu. Dr. Tushar Shah, consulting physician at Advanced Multispeciality Hospital, Mumbai, and also who has trained more than 3,000 doctors for providing home services and remote medical advice to COVID patients. Dr. Nilima Vaidya Bhamre, gynecologist obstetrician of Maturshri Nursing Home. I know of Dr. Nilima Bhamre because she is the president-elect of AMC, and she is always approachable, working very hard for the situation of which we are in any specialty possible. Dr. Anand Parihar, past president of AMC, radiologist, managing trustee of Mother Charitable Trust. Dr. Shruti Manaktala, doctor in homeopathy, psychiatry, founder of Devik Sparsh. And finally, Anjali Damania, who is an anti-corruption and social activist. She was part of India Against Corruption campaign of Anna Hazare in 2011. Later, she joined the Aam Aadmi Party and became a convener of its Maharashtra unit. In 2015, she resigned from AAP and she has a labor union called Niswarth Kamgar Sangatna and is a trustee of Voice of Indian Taxpayers. I must say, with all the experience that I have seen of Mumbai Dhadkan, it definitely heart of all Mumbai hearts. Thank you very much. I now welcome Dr. Anjali Chabria.
Thank you so much for this welcome, Juhi. It's always so beautiful to see you, and thank you to the foundation for honoring us. What we started as a journey of some Mumbaikars coming together because we felt our heart was beating for Mumbai. And very early in the struggle, we also realized that there is that much that we could do as individuals. So when the pandemic started, I realized that Golden Citizens Trust was trying, but yes, we just felt that we were struggling and we could not match all the needs. And that's when I came across like-minded individuals and organizations. And yes, let me tell you that I have discovered my best friends in the last 1 year because these are individuals who come together for any cause. So when we started working together, what we realized the need at that time was PPEs, was masks, and there was masks were being sold at some ridiculous amount, of money. And all of us were feeling really helpless. And I think the common theme of helplessness got us together, and we realized that in together we could make at least a better difference. So I remember us feeling terrible when a doctor could not reach a hospital because there was no ambulance to take him. And that was the day we felt that let us get ambulances down, let us try and get the cost down so that at least people do not figure out how to reach a hospital. Let us make sure that the ambulance reaches them in time and brings them to the hospital in time. Then came the need of oxygen concentrators. At that time, we realized that there were people who were just going to hospital to get oxygen. So why not give them oxygen at home and reduce the stay of hospitalization? So together we got a few oxygen concentrators. I say few because, of course, Mumbai is a big city. But we felt that at least if an oxygen concentrator can reach people, in time, then they do not die of oxygen or their oxygen does not drop. And we get a little time because at that time, the Dr. Tushar Shah, who was educating us throughout, said that people die because of lack of oxygen. So together we came across, we procured some oxygen concentrators, put them in different areas, and just spread the word and said, whoever wants an oxygen concentrator, please go ahead and just contact these numbers. And yes, along with that, we were doing our best to see if we could meet some of the needs. You know, our authorities, of course, have been doing a fantastic job. You know, I must say that Mumbai and Maharashtra has really coped well, you know, but it was wherever we could just fill in our needs, you know, whether it was distributing masks, whether it was giving sanitizers, whether it was helping the hospital. And what we also tried to ensure was that our resources were not getting wasted. So we would talk to the hospital doctors, we would try and talk to the authorities and see that, okay, these are resources and we want to ensure that they are not getting wasted. So that was a little difference that we tried to make. And yes, together we hope to continue these services. And of course, now I think I would ask Charuta, who's our youngest member of the group, you know, to tell us a little more about what has been happening now.
Thank you, Dr. Anjali Chabria. So I must say that Dr. Anjali Chabria was the person who got all of us together and brought us. I mean, I didn't know any of these wonderful people before I joined Mumbai Dhadkan, and it's been a wonderful journey, and we've been able to do 100 times more just by having 9 more people. So we did initially we did this plasma campaign, which didn't really it worked really well because we could connect the donors as well as the recipients. But as soon as we realized that it was not the science showed that it was not very beneficial, then we wrapped it up, and then we did at least 10 in the second wave itself with various organizations and hospitals. We have done many blood donation camps which have been hugely successful and have helped mainly Tata Memorial, Cooper Hospital, and a couple of other public hospitals also. Then we realized that in the second wave, a big gap was in the understanding of the resident doctors. Junior doctors were pulled in again into working in the wards and COVID duties. Like, I'm an ophthalmologist, and my residents were again dragged into COVID duties. So there, the whole year is passing by. So we decided to give them a little bit of relief and some mental wellness, because I knew that they are struggling. They are having some anxiety attacks, but they are not really seeking help. So what we, in the form of an entertainment program, but also added on to that, we had a some wellness program. So then there was a Sonu Nigam program where he interacted with the resident doctors, and those who could sing were able to sing with him. So that was like a big big day for them. And Dr. Anjali Chabria took questions on how to deal with the mental stress. We are currently having an ongoing singing talent hunt of doctors, and they really sing so beautifully, and so the music is always a release, and music is magical. As the yoga session is being had with the yoga teacher Ankita Sood, and also again Hari Shetty has very graciously accepted all of our requests to take on healthcare questions and suggest small tips. So, and then there have been many doctors who have joined us to keep classes. There's a dance class, there was a bhangra class, there was a pranayam class. So there are ongoing things which happen every week, and it gives the doctors and healthcare workers a little bit of relief in the week, and it's been successful. We've opened it to nurses, all frontliners. There was another Unwind as a comedy with Atul Khatri, as well as again Dr. Hari Shetty took a lot of questions, and the residents who were very scared to even open up and talk, they asked all their questions, and they could it was they want more of them. So we realized that we are on the right path here. We had some celebrities endorsing our what we were doing, and I think that was a picture of that. Now with this, I'm just going to Rajeshri. Thank you so much. I mean, there are so many organizations doing great work. And I'm going to call on Anjali Damania, who's the only non-doctor, but sometimes we forget that and we call her Dr. Anjali Damania also. So she is a pillar of support and always, at the back, doesn't, come in the limelight. And she has a new project, so that's we are looking forward all the time and changing ourselves according to the need. In the second wave, I hope the third wave doesn't happen, but she's going to tell us a little bit about it.
I think we have lost. She was online, but I'm trying to reach her, but maybe I think she is in a location where she's not able to connect.
You can just show the earlier slide. I'll just, I hope she can join back. But in
Is
the
Dr. Damani?
meanwhile, she has been going to various villages, Khalapur, Khopoli, and various villages and talukas, and figuring out, what is the need. And definitely the need right now is to upskill. So upskill and judicious capacity building, so that many people have got oxygen concentrators, but sometimes they don't have training, they don't have pulse oximeters, or the ASHA workers are not trained. So we are planning to adopt a few after going there and checking them. That's her there, checking out themselves what the need is, and talking to the village chiefs, and also along with the government. She is brought on this project, and we are very enthusiastic to take it on to the next level of adopting a few villages as a pilot, to upskill, give them material, help them, and monitor the progress and see that what we are doing is working, or if it is not working, then change it. And we have a little bit of time now where the cases are down, and hopefully we can help them materially also, and upgrading their skills and getting them ready, reducing the fears, increasing masking, and vaccine advocacy. So that's the next plan for Mumbai Dharkan. Again, we as a team would like to thank Shri for recognizing all of these people today. And every time your programs are wonderful, because you make it a point to recognize people who are doing work, and there are so many of them. Thank you so much.
Dr. Charuta, I want to also thank you, because you've been also participating in some of my programs, and we have been trying to take the good work at different scales, taking it ahead. But and I learned about Mumbai Dharkan from you, and so proud to know all the work. And I've gotten connected to Dr. Anjali Chabria, and I can only guess, what a pleasure it is for all of you to work together and to contribute to this cause. You are just amazing women, and of course, men who are also there. But it's just great to see what you have been doing. The amount of energy, the happiness that you're spreading, I think that's the key. And that's why the award, and of course the name says it all. Like I said, Mumbai Dharkan. So I would definitely want Dr. Ture sir to come forth to speak a few words about this initiative, which was quite ably. They will never say that they are doing anything big, but they have been doing everything small and big that they can, for patients, for doctors, residents, for support staff. For I think they have done work for also the other COVID warriors, like the police, and they've been doing so much around that. So over to you, Dr. Roture, and while we will present the award to them as well.
Yeah, thank you, Rajeshri. And before I say anything, I think Namaskar, Madam Manke. I was very, very close to
Namaskar, namaskar. So nice to hear from you.
I think the only one sentence which I can truly describe this group is they are the true Dhadkan of Mumbai. I have been hearing so much about this group, especially from my dear friends Nilima and from Anand also. And then hearing so much about them on all the media, social media. The tremendous amount of work that they have been doing and going beyond the call of duty. Some majority doctors I see over here, right from Dr. Anjali and Dr. Charuta Manke and everybody. And they work especially on plasma. It is something which nobody took up, and this was the group which really took it up on a huge scale, and made it so popular that people came forward to donate plasma. So we have to thank them for that also. Not only that, I think Madam Damania is not over here, but let me tell you, we have been, as IMA activists, we have been fighting in the beginning with the government as far as the charges of the masks and PPEs are concerned. And she and Madam Sucheta Madam took that to court, and got a positive result. And today, let me tell you, these N95 masks which were available for 300 and 350 rupees, today they are available for 26 rupees to all the doctors, which has gone, it has really helped us, because it was possible for us to work very comfortably and without fear in all these COVID centers. So we have to thank this whole group over here. And, the latest thing, I think, which not very much they have, told us, is the work, I think, and that must be a little bit influence of Dr. Anjali, that the next wave that we are going to see, and that is going to affect psychologically a lot of the medical fraternity also. And what I have attended their program, especially Sonu Nigam, and this, I have been online just to see what they are doing. They're doing great for the residents. I think residents, basically, I have been saying right from before, are a true frontline warriors who are there. They are there on the border. We are there to support them, but they are there at the border, and to keep psychologically their ethos up, and their this to work in such situations, I think, which is something, again, great work that you all have been doing. I can only say, continue doing this work. Yeoman service you are doing, not only to the citizens but even to the medical fraternity. And I hope you all continue doing this work and do much more. You have the capacity, the capability of doing it. God given gift is there in all of you, and I think which will go a long way in helping the fraternity. And I would say thank you very much for helping the whole medical fraternity and the citizens. All your PP kit donations, I've been reading everything on social media, as I said. And I would like to repeat, the true Dhadkan of Mumbai is this group. Thank you very much.
I would also like to thank Dr. Alka Mandke to be with us today. And last year we had, of course, presented an award to Dr. Nitu Mandke, and it was such a special occasion to have the entire family with Dr. Charuta and Dr. Zui. I would like to thank Dr. Zui for also, coming down and actually introducing the group, and Dr. Charuta to, of course, help bring the team of Mumbai Dhadkan here. And it's such a proud pleasure and, like I said, happiness to share this award with you. We are really obliged, of course, with the work. And what after Dr. Utre has mentioned, I don't think I need to say anything more. But thank you for all that you've done for us.
Thank you. Thank you for including us today. And I think we are family now. So we are going to be, you're going to be joining us soon.
Yes, of course. And any help, we are always there. I'm sure once your work and our work comes together, it's just going to multiply rather, in many ways. So thank you so much again, Dr. Anjali Chabria, for being here and making this. It's been your brainchild, and you really nurtured it. And of course, so many of these doctors, all of you together, have really made it a Mumbai Dhadkan. So we will, of course, have to move on to the next award, though, virtually we can't be with you personally, but yet we will move to the next award. And the next award we will be presenting to Dr. Taral Nagda. And sir, this is a special award for you, and it sort of is coming straight from our heart. And this may or may not do much. It may not be about COVID directly, but you're an inspiration. First of all, give me the privilege to introduce you. He's consultant pediatric orthopedician at SRCC Hospital, Jupiter Hospital, Hinduja Hospital. He has been associate professor and lecturer at the GS Medical College and KM Hospital for 9 years, associated with outreach programs for children with disabilities with various institutes and NGOs in India. Director, Institute of Pediatric Orthopedic Disorders, IPOD, which supports children with orthopedic and neuromuscular problems from India and other parts of the world. iPod extends services to economically challenged through free camps in India and abroad. His expertise is in deformity correction by percutaneous techniques and growth modulation in children, management of cerebral palsy with ultrasound guided botulinum toxin, and correction of spinal deformities. Um, Also, his active interests are in gadgets and uses his creative skills really in education and training for budding pediatric orthopedicians. I want to share a screen here just to share the happiness. Uh, it's a pleasure to have you with us, Dr. Alnavda. And you are sort of our superhero. You spreading happiness is really what we know after we have worked with you on several fronts. So I would really welcome you on the virtual stage to share your near to death experience is what we know. And with the courage and grit that you've come out of it, we want you to share your story. And I'm sure it's going to be inspiring for lot many doctors and common people out there. And what you have fought through this pandemic is something um, I have no words for it actually. Over to you, sir.
Yeah, so thanks, Rajashri. It was 17th of February. We were returning from Rajasthan on a road trip, me and my wife. And near Valsad, we had a accident of a car. It was 4 in the afternoon. And this time suddenly changed our lives. Because me and my wife both had accidents. I had L3-4 fracture dislocation of spine. In a minute, my legs, which were known to move all over India and abroad, and we were doing so many things. People would say that Taral Lagda, my name is, means fluid, and I cannot be at one place, and would be from one place to another. And suddenly my legs were paralyzed because of this fracture. And a lot of people helped. In the time to come, I was shifted to Hinduja Hospital, operated by my dear friend Dr. Samir Dalvi within 24 hours. And then subsequently, I was shifted to Jupiter for neuro rehabilitation. Last 4 months, I've been really working hard to get myself recovered, and already, I'm walking with crutches, been shifted at home, and already started seeing some patients and operating. What I really want to, say today, Rajashri, I'm not going to take much of your time, but the operating words for our program, we thought were wisdom and excellence. We must add one more word, which is resilience. We always prepare for a success. We never prepare for a bad time. And this preparation is very, very important for us as doctors. It's also important that we train our children into accepting failures, defeats, bad times, how to maintain balance of mind, how to accept realities, how to move ahead and go and yet create something in adverse situations. Today you have two programs, Rajesh. One which is happening right now, one which is happening in the evening. The one which is happening right now is an tribute to people who have done something in spite of all adversities. People who have worked in COVID, people who have worked against all odds to make it happen. And that's training, that's the art, that's what we want to convey to people, that please prepare for this. And one of the ways I think I could prepare for it was by doing yoga actively over the last 4 to 5 years, to get your mind in the situation of balance in adverse conditions. And for all the doctors and everybody, this training is extremely important. That is what I feel. I feel that Mr. Gadgil, we remember him for brands which he created. At the same time, we must understand there have been brands which were lost in time, and he did not get put off by these situations. He still kept on inventing himself and came up with brands which are so in these life, and I just want to say something for me, and this in the few lines is मौत के दर पे दस्तक दे गया हूँ, ओके तो कुछ पाके आया हूँ, अब बिना दरो दीवार मेरा आशिया ना हो. So my house windows
So
open
your
to
voice is
everybody.
breaking.
I should be okay. So I'll repeat again.
Yeah.
Is this clear now, Rajshri?
Yeah.
Okay.
Yes.
मौत के दर पे तब तक देके आया हूँ. I've force of death and come back. Okay. कुछ खोके तो कुछ पाके आया हूँ. I've lost something but gained a lot. अब बिना दरो दीवार मेरा आशिया ना हो. My house should be open to everybody. Which should be without any doors, windows. It should be an open. My life should be a transparent one. नई जिंदगी से ये वादा करके आया हूँ. It's a new life for me, and it's my promise to this new life that it's going to be different than what it was before.
Your voice is breaking again.
For the society, for people whom I love to work. Yeah. Lot of implication for the society and people who work for me and for whom I want to work. Shri, thanks for the award, and it is a tribute to all people who have suffered a neurological issue, and it's to the spirit of coming out of this and reinventing yourself. Thank you very much.
Before we present him the award, I want to say a few words. This man, we met him a week before, probably a couple of weeks before all this happened, and we were unnerved when we came to know about all this. And one more person on this panel felt the same, and I'm going to bring Dr. Ashish Arbhat in as well. But this is how we felt when we even came to know about it, and we were speechless. We didn't know there were news flying saying that you met a very bad accident. We don't know how it's going to be. Of course, a lot of people speculated saying that you're probably never going to get back into action. And here you are. That's the spirit of Dr. Taral Nagda is what I would say. And you've always been a part of this wisdom and excellence mission with me. You've always encouraged me, pushed me to do things. You always wanted me to do these awards for more number of people and not just doing it for the stalwarts. And here I am doing it, and here you are with me is something which is absolutely it's from the bottom of my heart. Sir, you're an amazing person. We know, and your creativity and your energy, we all know, is par excellence. This award, we would have never imagined you giving it to you in this way, but we are very proud that you're with us today, and for sharing your.
Can I just say something? RSG has a meaning for me now. R is for resilience, S is for spirituality, and G is for get going. Whatever happens, keep going. That is the new meaning of RSG today from after this award.
Yes, Dr. Ashish, do you want? I'm sure you would want to say something, which is why we invited you. If you could, in a few words, express yourself.
Hello, sir. Nice to see you. We have always hero worshipped, at least me have hero worshipped Dr. Taral. And the heroes don't know who look behind them, and he is always a hero. He'll always be an hero. And God bless you, sir. I would make it a point to come and see you whenever it's possible. But my hero worship has been, unending, and it's now just increased leaps and bounds. You are a hero for all of us. God bless you. And this time, I really, I broke down after must be 15 years of my life. But the way I'm seeing him back, I'm keeping a close watch. And sir, we are always with you in whatever endeavors you do. Whenever you need me, I'm your 3am slave. You are our hero. Be that. We are very proud of you. Thank you,
Great. So,
Rajashri, for making me
yes,
say
on
these
that,
words.
Rajshri,
note,
Rajshri, can I say a few words for Dr. Taral?
please.
Thank you. Dr. Taral, good afternoon. I am Mangesh Divaskar. You must not have met me. You must not have heard about me. Shiv, it is very nice to see you. And I'm a physician currently, and I'm General Secretary of Association of Physicians of India. And I've heard of you a lot. I've heard stories about you a lot. Your good wills, your good deeds. So I have a small, I would say, share for you, for your bravery, for resilience that you said. And I'll just utter those words for you, sir. That बहादुरों के किस्से अजीब होते हैं, अक्सर दुखी उन्हें नसीब होते हैं, टूटने लगते हैं हौसले तो याद रखना, बिना मेहनत के तक तो ताज नसीब नहीं होते, ढूंढ लेते हैं अंधेरों से भी मंजिल अपनी, क्योंकि जुगनू कभी रोशनी के मोहताज नहीं होते. All for you, sir. Very well done. We are so proud of you.
Thank you so much.
Sorry, I'm speechless. I just don't know what to say. But I would really request Dr. Uture to come forth and present this award. I'm emotional, but you've all made me emotional. So I miss RSG on this note, of course, but he is with us. Over to you, Dr. Uture, sir.
Yeah, thank you, Rajeshri. I have met Dr. Nagda in a couple of IMA programs. And let me tell you that his contribution towards pediatric ortho has been tremendous. And the few photographs that you showed us was definitely tells us whatever his contribution has done. But today, what he has done is by coming in front of all of us, because we have been hearing what he has been going through in IMA also. But today, when he came forward, and instead of talking about himself, he gave some advice to the doctors to what they should advise their children and their juniors. I think that speaks volumes for this person's, mental strength, that he could come out of this whole thing. And today, not as a clinician and as an orthopedician, but I think we can learn a lot from him, how he has bounced back. And the only thing I can say is that we hope, sir, you come back into the fold at the earliest, and we are sure you will do that, because you have already said that you have started seeing your patients also. And I hope I can meet you sometime personally also, and learn a lot from you about how to face adversities in life. Let me tell you that we hear stories, but to experience it is something very, very different. And almost 90-95% of the people collapse mentally. And there are very few like you who can, come back and bounce back much more strongly. And this is going to be an inspiration to all your medical colleagues, even in the future, especially during this COVID times. I have seen a lot of people, a lot of my colleagues who have succumbed to the disease, or who have got permanently some problems, post-COVID problems, where they cannot go back to their normal life. And I think your inspirational story will definitely help them in bouncing back and getting them mentally strong. And you deserve this award. And I congratulate you, and I congratulate even Rajeshri for having bestowed on him this award. Thank you very much.
Thank you very much for being here, Dr. Taral Nagda. As always, as every year, and I'm happy you're here as every year. Dr. Tivaskar, your share had to do it to me, but we'll move forward to the next award, which is, of course, we have to move to the ones, because two more best awards lined up, and last but not the least, the RSG Excellence Award in Patient Care to Dr. Salil Bendre, who is with us. And he has been having an extremely busy schedule already because he's in a field which is completely unavoidable as a chest physician. So I would invite him on the virtual stage, and I would of course want Dr. Mehul Thakkar to do the honors. Dr. Mehul Thakkar has been doing great work again. He's attached to the Jupiter Hospital and several other places doing. He's one of the leading chest physicians in Thane and Mumbai areas. Uh, I would request him to actually introduce Dr. Salil Bendre because he's really known him closely, and he will definitely bring out more than just his degrees out in his introduction. Pleasure to have both of you on the virtual stage.
Thank you. It's actually a pleasure to be here and introduce Dr. Salil sir, because when I was told that I have to introduce Dr. Salil, I was like, I mean, kitne slides banao? How much can I write in the slide about his persona and the things that he has achieved? But just to brief you, he is a well-known pulmonologist. He practices on Western side. He's in head of department of pulmonology at Nanavati Hospital. He's a president of Environmental Medical Association of India. He was the professor and head of chest medicine at KJ Somaiya Medical College. He is a teacher par excellence. He is a teacher for DNB. He's a teacher and examiner for CPS, and also an MUHS recognized teacher. Those are the things that you can read anyone anywhere online his profile. But as few of our colleagues mentioned, that he's an accidental doctor. He's an excellent magician. He takes classes for magic. He is a good musician, does mimicry. But what he has done now in this COVID time is something which was demanded by the profession, and what he went out of the way and treated COVID patients in this era. He was a guiding light for all of us. Like Nanavati was one of the earlier hospitals to start COVID care, and we could learn a lot from him. Like, how is he experiencing? You get guidelines, but personal experiences, how to tackle situations, how to handle complications, when to transfer, what drug to give, and all the new age cutting edge therapy which come. And he's at the forefront to try out in these patients and give us an idea. And it has been a pleasure. And we are part of a group called Pulmonix, where as a chest physician, we feel that we have learned everything, but we always learn, always know something more when we communicate with him. So it's my honor to introduce him today. And Salil sir, it is you are the right choice for this excellence award. Over to you, sir.
Thank you so much. So first of all, I should thank Mehul for such a generous introduction. Rajeshri, I am interacting with you for the first time. So it's my pleasure to be associated with the RSG Wisdom Forum. And thank you for inviting me and appreciating whatever work or little bit of work which I am doing. But I'm more delighted to see my friends here, Dr. Mangesh Tiwaskar. He's been a dear friend of mine. We have traveled together, we have worked together. Utture sir, he's known to all the consultants and he's a well-known name everywhere. Dr. Manke ma'am, I know her since a long time. So to see these faces, to interact with them is a pleasure of mine. So I'm really thankful and humbled. I won't say much about what I'm doing. I would say that as doctors, I think Mehul and myself and many others like Mangesh and every one of us have been working, selflessly. And I think this award, whatever it would be in terms of wisdom, excellence, integrity, persistence, patience, you talk of every emotion or every passion, it is all related to healthcare. Somehow these COVID times has really made me introspect, and every doctor has started introspecting about the bluntness of life. Sometimes we take things too much for granted as to what will happen, and I can do this. Whenever I have gone to the bank, the bank manager says, sir, there is a plan for the next 10 years. And if you invest for 10 years, you will get more interest. Then there are mutual funds, there are SIPs, and you plan for your retirement. Trust me, but this COVID has taught us the completely opposite. It is what we are today. I would say what we are just now. That matters. How you live life today and just now is what matters. What will be ahead and what will be tomorrow is nothing. We have seen as doctors, people die. We have seen patients get admitted in the morning and die in the evening. We have gone to the ICUs wearing the PPE suits, not really knowing what will be happening for us in the next 7 to 10 days. Our own colleagues have been admitted with cough and fever where they were treating patients. There was a patient on Monday, and on the 7th day, that patient has been discharged, but my colleague has been admitted and he's been on oxygen. He's been treated. So there have been n number of incidences which I don't think can be actually assimilated into what we are doing as something excellent or what we are doing as something very wise. We are just doing practical life. We are just working on the Hippocrates oath, which we all have taken to do good for humanity in the given circumstances. Because, you know, there's a line which says, this too shall pass. These 4 words actually summarize everything which each of us has today. May it be the good times and we are very successful. This too shall pass. And may it be the most sad part of life, most lowest point of our life, but this too shall pass. So this kind of understanding and introspection, I suppose, is what every one of us has learned. Relatives not meeting patients, relatives unable to meet patients, we have been able to, you know, see them, cry with them at times, treat them. We have seen the mad rush for remdesivir, mad rush for tocilizumab and for plasma, relatives running at midnights, coming back, unable to get the medicines, and we being helpless. So it is this spark within all of us, I would not say doctors, medical professionals, because if there is credit to me as Dr. Salil Bendre, there is equal credit to the nurse who has worked with me. There is equal credit to the ward boy who has worked with me. There is equal credit to the mausi who has gone to the bedside of a patient to take the machines or the catheters out. And there is equal credit to the frontline RMOs, residents who have been working there. As a consultant, perhaps I have gone there for 1 hour, but the resident has done an 8 to 12 hour of shift duty in that same ICU. So I would be just a representative, I think, for this wonderful acclamation of, you know, work which we have done as healthcare professionals. But I think the spirit never dries. We are going to work. We are going to come what may. COVID comes, 3rd wave, 4th wave, 5th May, let it come. We are ready to tackle it and battle it and win over it. I think that's the only thing I can say. And I thank you from the bottom of my heart for all the doctors that this award, this appreciation is for them and all the paramedics who have worked during this pandemic. Thank you.
What an energizing, talk. Whatever we are going through right now, and you are probably at the most forefront of it. And the way you're talking about it itself really, helps us brave this. Whatever is going to come forth, yes, we are all prepared really to fight it. So much. Thank you so much for actually recognizing so many people out there and, sort of representing, the entire fraternity. That sir means a lot, and for us it's an honor that you've joined us.
Rajeshri,
And
one more thing that Salil has a very beautiful specialty, that his selfless teaching ambition, passion for teaching and spreading awareness of the latest he won, and that was absolutely selfless. You could see in him on any forum, no matter it could be a social media, it could be an electronic media, print media, everywhere. He gave his best. That's what Salil is.
Thank you, Mangesh. Thank you for that.
And that's what I love. And as Mehul has already beautifully said, you should see him doing his magic tricks. He'll get bamboozled, boss. I sometimes thought of what guy he is here. And he does it with such an ease and amazing fluency that Mehul would definitely see. He must have witnessed. And you should see his close magic. Magic probably, we always see that can be enjoyed from the distance. But watch his close magic, close to your eyes, and still you get buffooned. So
we've already got the glimpse of it, honestly.
My God.
Because energy was the first word I could utter from my mouth. But I thank Dr. Mehul Thakkar really for introducing him, and he absolutely wanted to do it. But one more person I must recognize, and that is Dr. Vedas Nimkar.
Yeah.
Dr. Vedas, we would definitely want you to be on the virtual stage with us. Yes.
Yeah, Rajeshri, there's some problem with.
But we would definitely want to thank you for
Yeah.
inviting Dr. Salil Bindre, and it's a privilege to have him. And you have yourself, we want to thank you because for being a part of a team, sort of, and pushing us forward all through these tough times and busy schedules and routines you have been having. Despite that, you helped us make this happen. So thank you very much, Dr. Vedas Limkar.
Thank you.
And on that note, of course, we would want Dr. Uture to add his great magic and flavor while we present the award to Dr. Salil Bindre.
Yeah, thank you, Rajeshri. I think I have heard Dr. Bendre in a couple of webinars, and as everybody has said, he's an excellent teacher. I didn't know he was a magician, but let me tell you, this whole group of doctors, may it be pulmonologists, intensivists, or MD physicians who have worked, the real magic has been done by them. See, because this was a new disease, none of us knew, and I don't think they also knew what this disease was and how to treat it, what would be the protocols to be followed, how to manage it. And they have weaved this magic. And this magic, not only have they weaved it, but a magician never tells his secrets. But these secrets they have brought to the whole medical fraternity by their webinars and by their teachings. And that I would feel that that is the true magic, because today we know what to do and what not to do because of these people who have worked on the forefront and in those ICUs and those wards. And that is another beauty of this medical profession. As professionals, let me tell you, medical profession is the only profession where the experts go out and share their experiences and their expertise with their colleagues and their juniors without charging a pie. I know so many of my friends who are there, CAs and lawyers and the other professions. Wherever the who's who in them go and give lectures, they always see to it that their remuneration is always there. And medical profession is the only profession where we go forward and where we share what we have learned with our colleagues. And that is what Dr. Bendre and I think I must thank all these respiratory people who have, because this is basically a respiratory disease, which is there, which we are seeing. And they have shared whatever they have learned with all of us so that we can manage these patients and we know what to do for our patients, when to refer them, when to send them to a center, when to give them home treatment, home isolation, home quarantine. And we have learned from these teachers, and these have been really good teachers. And that is the reason why today we find more than 75% to 80% of the patients who are in home isolation and are being treated, say, by the family physicians or the physicians or people like us. And that has been possible purely because we have learned from these experts. So thank you very much, Dr. Salil Bendre, for this expertise and this magic that you have shared with us. What are the nuances of this magic with us, so that all these patients we can treat properly.
Thank you so much.
You deserve this award, and thank you very much.
Thank you so much.
Like he says, bring it on, and we are prepared to fight it. I think that's the amazing spirit I think he really is brought to us, and I feel inspired. I'm sure of so many of you watching you, sir, just feel like that. I mean, though we are going to hit many more waves, and we are going to be, it's tireless, untiring effort that we are going to be putting at it, but amazing spirit you have instilled into us. I would like to thank you again for receiving this award, and I'm sure we will be interacting with you more to spread more and more about the disease and how to tackle the same. Thank you again, and we will, of course, I will want you to wait on for the person who's kept adding about you. I can only, gather, he's the only person I can probably say that, you know what, you're going to be at the end of the program. I can take the liberty, I can uh, easily take there's no courage in it, because people wait to listen to him. And every time he speaks, we know what his share did to me today. But what he has done through this pandemic, and I personally know, because of his wife especially, that what he's gone through, and the way he has kept his grit, and he has really transformed Tanvi Nursing Home. Though he's so simple that he names it Tanvi Nursing Home. A family name, and he always says that to me. You have to. You should always be in adversities, so that you will keep working hard to excel. And I will never forget that, Dr. Mangesh Tivaskar. And that's what you've done. And what I mean, without Dr. Shilpa Tivaskar, who's such a strong partner that you have, and more partners that you have. But we have one more special friend of ours with us today to introduce you. I definitely want him to take the honor of introducing you, and that is Dr. Amit Saraf, another very leading, uh, I would say, physician. He's the head of the department, and he does. Uh, he's super ustam for lot many, and the most modest person around, but we know the truckloads of work, and the type of work that he does. So, Dr. Amit Saraf, it's a pleasure that we have you with us. Of course, to introduce Mangesh Tivaskar sir, and please, the floor is really open for you to introduce him.
Thank you, Rajeshri. I think the day belongs to all these people who receive the award, but also belongs to you, your late father. What a auspicious day on a Father's Day that you're having an RSG award celebration. So congratulations to you first and foremostly for bringing this together. The kind of people you've got on this platform and you're awarding today, I think speaks volumes about the kind of work, the contacts, the good name that your father and you are carrying forward. So congratulations to you. And I believe the first sort of appreciation award should go to you. So thank you, Rajeshri. Thank you for having me here on this magnanimous stage. And coming to the person I'm going to introduce, I called him up this morning and I was rubbing my hand in glee that he keeps on having this marvelous words for me when I call him up. And I thought, sir, if there is a God there, today he has heard me, and I am using the platform for giving it back, giving it completely back. But, I initially thought it can be an academic introduction. Dr. Tivaskar, we all know that he has a legacy. His own father was a phenomenal teacher, taught generations and generations of students. Like your own father, Rajeshri, he's taking the name forward. The Tivaskar name and the family name is here to stay. We'll keep on making academic waves for generations and generations to come. So the first sort of feather in his cap is he's been a worthy son and an absolute true to the family name, and he's carrying his father's legacy forward. We're all aware of the academic accolades. I don't need to go there. He's a gold medalist at his MD medicine. He's a gold medalist in many other subjects, from pharmacology to microbiology. He's been abroad to study his diabetology. He's a very successful diabetologist and an internist. But let me share a glimpse of the man's life, which I have seen in the past some months that I have been fortunate to be a little close to him. We should see how he interacts with the API staff, the office staff. He will make them feel so comfortable. We all see a person's academic and a professional side. We talk about the patients we treat and all that, which is true, which is very much required. But as a honorary secretary general of the Association of Physicians of India, with the staff over there in our office for years together, he will make them feel so much at home. You should see the love and respect they shower upon him when he approaches the office, when he is over there. They will be at his beck and call, not because of the fear factor he commands, because of the love and affection which is given them back over the years. In his eyes, nobody is small or large or big. I think that it's all equal in his eyes. I am a living example of that. I honestly still believe I am nothing, and I am a nobody in the API circles or even physician circles. But he's never made me feel that. He's always made me feel something special, and that he makes everybody who comes in touch with him, be it a patient or a colleague or a office staff. So that is Dr. Mangesh Tivaskar to you. And I believe that is only and only possible because a man's heart is where his home is. And that is only possible because of the wonderful family he has. Madam Tivaskar, I have met, and I see that she is the real strong backbone behind Sir, the hospital, and she carries it forward. She'd been a senior to my wife in Nair Hospital. So I hear wonder stories about her, the way she's made Sonali learn and way she can practice her own anesthesia. Sir's lovely two children, I think, are another loving factors in grooming him as a person. So I believe it's a pleasure, it's a privilege for me to even talk about him on this platform here. And I congratulate them both for this absolutely prestigious award and the Tanvi Hospital as well. Sir, thank you so much. I think I've spoken enough. I hope I have given back everything that you have spoken to me over the last so many months and years. And thank you so much for allowing the opportunity to be there, Rajesh.
Thank you, Amit. Thank you very much. I really
More
appreciate
than a
this.
pleasure, Dr. Amit. And over to you, sir. The
Thank you
stage
very
is
much.
open.
What
And you're the last, so you like Dr. Boraskar says, there's no timekeeper available out there. So
No question about
and we are going to be mesmerized with
Thank you.
your
Thank you
talk.
so much.
But
Thank
be
you so
wonderful.
much. And thank you, Shift, for being there throughout. Thank you very much. She has been one of the true supporters, my not only senior, but always my well wisher. I had an opportunity, wonderful opportunities to be there alongside of him. It's been always one of those mentors. And Amit, as usual, you made my day. And it's very nice to hear good things about. My wife is witnessing, so at least she'll realize that I am a good man, I am a good husband for her. And I would also again say that the story started maybe possibly that learning, that education started when I still remember, Amit, that will be interesting for you also, Shiv, that I still remember that I was sitting in Nair OPD. This must be 92, somewhere in December or something like that. And here walks a man, a bald man, a little obese man, a fatty man, and introduces me, sir. I am RS Gadgil. I head the team USV division here. Okay. And I am here to promote not my products, not my brands, but I am here to promote science. I am here to promote education. I am here to promote and help you guys. We have to have an updated knowledge. Now, believe me, I am talking about those days when there was no internet. Believe me, I am talking about those days where libraries and books and journals, hard copies were the only source of your updated information. And here was Mr. R.S. Gadgil assuring me that he can make and help us in getting membership of one of the most prestigious journals. I still remember that he was the one who has actually offered us in Nair Hospital. Now we all know municipal hospitals, they do not have any commercial interest to serve to any pharmaceutical companies. But he was a guy who saw to it that actually the Clinics of North America subscription was annually renewed to Nair Hospital Library. So that was RSG. And then after I started my practice in Dahisar, he did not forget me, a small man. And it was December 1993, where he walks in again and says, Dr. Mangesh, do you recognize me? And I was zapped. He was remembering my name. Who doesn't know RSG? But then this is what RSG was. Simplicity. So as Dr. Nagda said, it is not just resilience. It is his resilience superseded by the grit, the determination of the success. And that is what RSG stands for. And Rajeshri, I thank you for allowing me to be there as a part of your team. Thank you, Amit, for being so wonderful. And of course to my wife, she's been always there as a support. I don't know how much I would say we must have learned through this COVID. As Dr. Nagda was telling, I also realized that, we always prepare for the success, but we never ever prepare for the failure. And this I really, really, really learned when I was actually down with COVID and was hospitalized. And of course, it was that support, that I would say assurance, not only from my team, the entire team. And believe me, I was hospitalized in my own hospital. So you can imagine the stress and the tension that these people must have gone through. So I must mention the name of my partners, Dr. Jay Chaurasia, Dr. Jignesh Patel, Dr. Ramakant Verma, and my entire team of staff my entire resident staff, those who were there, and they taught me one thing is that it is not important to do the best. What is more important is to keep on doing it relentlessly. You keep on attempting relentlessly. That has made us really uh, uh, I would say reach where we are. And I would really appreciate you all for appreciating our efforts. Thank you very much once again, Ajay. And I'm really touched. I would now really request Shilpa to say a few words, if at all, and I would hear it from Shiv, for the final comments.
Thank you, Rajeshri and RSG Foundation. Rajeshri, it is a great honor to be on this platform. And you mean a lot to me and your foundation. You have been really doing a great job. I remember Rajeshri and me shared messages at around 2 o'clock. It was my on-call day and I'm seeing Rajeshri is online. Oh my God, she's planning for the next seminar. And I remember she had recognized our one Facebook seminar. She said, yes, I'd want to do for anesthetist. And Rajeshri, you have been really into it. You are more than a doctor. I have seen you even taking videos of actually in the first wave, where people were afraid to go near the doctors, near wearing PP, and you have been moving through all that. You not only it is the work, the hard work, the passion you have to help others, to help the society. I'm really proud of you. Really salute to you. We love you so much. And regarding our nursing home, yeah, Tanvi Nursing Home, these 4 partners, the staff, the sisters, the receptionist, everyone, it's not that because it's our nursing home. I'm just being in management, but I have seen them working for, and it's not only Tanvi Nursing Home, it's even in where I work at Bhakti Vedant or other nursing homes. All the staff, the class 3 workers, class 4 workers, they have worked selflessly through this 18 months. No expectations, no gains, no rest. And as Dr. Salil said, maybe we are just taking around maybe 1 hour, 2 hours, 3 hours, but they are doing 8 hours, 10 hours duty. And all these associations like the Mumbai Dhadkan and all, even Common Man, every association has come forward to just help each other, help humanity. And Rajeshri, I'm so proud of you. You're leading them, you're recognizing them. God bless you. Thank you, Rajeshri.
Thank you so much. I mean,
And thank you, Amit Saraf sir, also for the introduction.
Whatever I'm doing is nothing in comparison to what you've been doing. But I would want Dr. Tivaskar to add to the fact that, when it's a smaller hospital, what's really what do you say? I mean, the actual recipe of success, because you've been having great success at curing your patients. And what's the success behind it?
Yeah, fortunately, God has been kind to us. Honestly speaking, we did what is right and what the science has taught us. And as you would also agree, and Amit will also agree, that we stuck to the basics. We never got carried away with the tsunami of the information which was coming. We never changed our, I would say, management principles just because it has been arriving. And also, we were also at the same time we were also pretty flexible and get adjusted to the needs and demands. And also, we respected each and every patient's life as our own life. We tried to deliver the best from our heart. And especially the challenge was more basically because people were running short of the places in the hospital, short of places in the municipal hospital, in the government supported systems. But technically at our hospital, I can very proudly say that we tried to provide them all the possibility of treatment along with that and associate care at a very, very affordable cost. And this I can say very proudly because I'm sure that you will also must have got to learn about it, that during these times when there was a challenge as far as the huge economical constraints, the whole family, especially second wave, was so bad that number of people in the same family used to get sick, and then used to be a challenge for them. So we probably thought of that, and we continued doing the same basic principled work, and that is the reason why probably I would say that my team, I'm really very proud of them because they adjusted to the idea. It's very difficult to have the same people of the same thoughts and especially for such a prolonged time. Okay. So I really appreciate their, I would say, coordination also. And this was what probably we did. So we only did what their basics are. So we stuck to our basics and we continued on carrying on that path. That was the only thing that we did.
Yeah, here can I talk, Rajeshri?
Go ahead.
It's very difficult to appreciate husband, but he's such a humble person. And also, I would like to appreciate our co-doctors, Ramakant Vermaji and Dr. Ajay Chaurasia and Dr. Jignesh Patel. Yeah, just I remember March 2020, when our RMO, who was suspected COVID, and that time only Kasturba used to take patients, and COVID was just an enormous unknown enemy. And that poor girl had saturation dropping and probably COVID, and she was trying to get a place. And finally, Mangesh and the doctors said, okay, whatever comes to it, we will treat her. And she was the first patient in Tanvi Nursing Home in March 2020, end of March 2020, if I am not mistaken, Mangesh.
Yeah.
Yeah. And they treated her 15 days. She was on a non-invasive ventilation. She came out well. Now she's giving her service to COVID patients. Also, Rajeshri, I remember that as Dr. Salil said and Dr. Amit Saraf said, and all as Dr. Shiv sir will agree, all these doctors, they're working medically, scientifically, but they also have the passion. I have seen them crying if oxygen cylinder is, coming little late. I remember Mangesh, my God, he is talking to someone in Nasik, in Nagpur, in Solapur, and then he's following up every day. I was wondering how that is possible for these doctors. Really, all these doctors, fraternity, the intensivists, the chest physicians in forefront, the physicians, and all the IMA and API and all the supporting teams, they are really doing good. Thank you so much.
So while you're appreciating him, the other thing is also we have to understand that he's on continuous webinars, because some of us have the option to be on it or not. He doesn't have an option. So he's on webinars all the time, morning, evening, and then he's treating patients. And I would like to appreciate or mention, because you all have not spoken so much about yourselves, which is the reason why I am saying it, that Dr. Shilpa has been such a super back-end support also, apart from the fact that she's such a great anesthetist, innovation.
Oh, absolutely. And believe me, Rajeshri, why I can say that? I still remember when I received 2 shots of tocilizumab. Okay, this was 29th of July. I still distinctly remember last year. It was in the first wave. My scores on the CT scan were 11/25 and probably must have progressed. After receiving tocilizumab, you will not believe, my count shot up to 29,000. Our pathologist called up Shilpa. We want to kill him. Why he is there in our own nursing home? Why he is there in Daisy? Why don't you shift him to a tertiary care place? And believe me, this girl, after hearing this, very well dressed, fresh as a fiddle, walks into my chamber and say, "Hi, chalo partner, ghar pe chalte hai." These were her words. Believe me, I knew what must be going through her mind when somebody calls her up and says that, "Boss, he is in trouble. He is in absolute sepsis. What are you doing?" He needs to be there at the setup where all the facilities are there. And imagine that time when actually COVID was a real menace. Nobody had any idea about what is happening. And in that period, and not only that, she was not only managing home, not managing kids. I am in the hospital 10 days. She was managing each and every form. So you can imagine what must have gone through her mind. And still she walks into my room, says that, "Chalo partner, ghar pe chalte. Let's move home." That's what the.
So I can very proudly say the bottom line is always marry an anesthetist.
Yes, always.
Yes, Amit sir is also happy.
Yes, that's why he's saying that, right?
मी सोनालीला नेहमी म्हणतो की if I am crying out your name in agony, it is not out of love, because I know an anesthetist can revive very well. त्यावेळेस धावून यायचं. Don't take your time. ते प्रेमाने हाक मारत नाहीये.
Well, but she is a representation, and even Dr. Sonal, they are representation of the women who are at the, we may all be on the forefront, but we also have to be on the back front.
I'm feeling very conscious. I'm putting off.
So, women have done a lot of great job of being on the forefront and also at the back front, supporting all the doctors and the families. So, I think Dr. Shilpa Tivaskar is the representation of that. On that great note, I think we have to uh, give this award to both Dr. Mangesh Tivaskar and Dr. Shilpa Tivaskar. But I would love to, of course, invite Dr. Roture to come and say a few words. And of course, this is the end of the program. So if you could actually say a few words about Dr. Tivaskar and also, of course, give us a small valedictory speech so that we could actually end this great program, which we do not want it to end actually.
Yeah, thank you, Rajeshri. Mangesh ji, Mangesh ji, Mangesh ji. Now, I think purposely Rajeshri has kept the best batsman for the last. So I have been with him on many a stage and many a fora, and we always call him as a pocket dynamite. My only regret today is not seeing him physically on a stage. Yeah, because not only you should hear him, but you should also see him. His gestures, his arm movements, and everything. He's a sight to watch whenever he is giving his lectures. And as you have said, excellent teacher, fantastic orator, diction is superb, and of course, there is always humor in what he says also. And I think that is the reason why he has been, he has no other choice but to be on majority of the webinars. And I'm not only talking about COVID, but even before COVID, if you see his lectures in general, on all medical topics, I think have been excellent. I have myself being a surgeon, but I have enjoyed, and I've always said that seeing this man's energy, he should not be a physician. Physicians, we call them as professors, laid back, talking. So he has that pent up energy in him, which is true of a surgeon more than a physician. So so I think. Great job. All have, of course, madam. I don't have much experience of meeting her, means, but I've heard what she has done, and very fact that she could control such a dynamite, I think that speaks volumes as far as she is concerned. So both of you, I think, well deserved award. And Mangesh ji, please continue your teaching. As I said, this is one profession where we believe in teaching what we have learned and not keeping what we have learned to ourselves. And that is what will create better doctors of the future and better juniors, and that will go a great, to a great length in helping the citizens in general. So keep on teaching, keep on talking to your juniors, keep on, sharing all your experiences with everybody. And thank you very much. And you deserve, both of you deserve this award which Rajeshri has today bestowed on you. Thank you. So I think we have come to the end of the session. Though it has been quite a long session, I have enjoyed every moment of this session. And the only thing I would like to say is that I think, Rajeshri, I can go ahead.
Yes, absolutely.
Yeah.
Very
The
nice to hear
only
you,
thing
sir.
at the end of this session I can go ahead, because though I am a surgeon, I have been working in this COVID era right from day one. And though not directly involved in treating the patients, but definitely as far as the other aspects of administration, as far as getting the PPE kits and thousands of them through all my friends and NGOs, we have donated, especially to the residents of the medical colleges in Mumbai, because as I said, they were the ones who were on the front line and they required the maximum protection. And not only that, we have made a lot of changes in the council also, where if you remember, we have been the first council who have allowed legally for you to do telecommunication and telemedicine, even before the National Medical Commission came out with that. We have also brought forward, which I was telling the Health Minister of Goa, that we have brought forward a proposal in MMC which has been passed unanimously, where we have given legal protection to all our doctors who are treating the patients, saying that anything done in good faith. These government entities always have that last line in any act where they say anything done in good, so to protect themselves, anything done in good faith under this act will not be brought to the court of law. So we have done that in the council, where we have given this protection, and I think we are the only council in the whole of India we have given protection to our members. Having said that, let me tell you, yeoman service has been done by the medical fraternity during this whole COVID times. But one thing that we have learned during this COVID times, as I said, we keep on learning. This is the only profession which keeps on learning right up till the last day. We have learned is not only the scientific basis, but there is a spirituality basis also to how we manage and treat our patients. And that is what I think we have learned, because we have been too much concentrating on only the scientific basis, right from our student days of treating as far as modern medicine is concerned. But there is something which we have learned beyond that also during this COVID times, and that you can see by so many NGOs who have come forward, so many non-medical people who have come forward to help us out in managing these patients. You had this this Mumbai Dhadkan, where there are a lot of non-medical people in that group, and they have done fantastic work. And there are n number of such NGOs, n number of such associations who have come forward, and they have taught us this holistic view of treating these diseases. See, this is not going to be the first and not going to be the last pandemic or epidemic which is going to hit us. We have to be ready for the future also. A second thing, now I'm talking from the administrative and government point of view. A second thing that this pandemic has taught to the government entities, that it is high time they start concentrating and spending on health aspect also. We were hit so badly purely because health has been a subject which has been somehow ignored by these entities for years and years. If you see, we have got the least as far as the expenditure of our GDP is concerned on health aspects, and that is why we were hit so badly. So I think even the government has woken up to this. I hope that in future they understand that health is going to be the primary aspect, and we as activists, medical activists, have also tried to push it into their heads, that just like in the Western countries, even in the future, because this is the language they understand, that even in the future, elections are going to be held purely on the health aspect of how you are going to give to these citizens as far as the health is concerned. And now they have slowly also, this pandemic has even taught them this. So I always like to see the silver lining to any gray cloud, and one of the silver linings I have learned is that maybe tomorrow these administrators will also wake up and concentrate more on health, and concentrate especially on preventive health. Because let me tell you that if we spend X amount of money on preventive health, we are definitely going to save more than 100x by trying to treat these diseases. And that, I think you are also doing it, and I have to congratulate you on that, because you have been, as far as your company is concerned, TRUWELLTH, you have been concentrating on preventive health by bringing forward changes, especially in the non-communicable diseases which we are concentrating on. And I think definitely the time has come for us also to think more in terms of preventive health than curative health, because not only the expenditure part, but even the trauma through which the patients have to go through which their family members have to go through, and then of course through which the medical fraternity has to go through, is going to definitely be much better if we can concentrate more on preventive health. And before I end, as a corollary to that, I would say that even in this COVID times, unless the citizens, they remember this protocol of the masking, physical distancing, and hand hygiene is concerned, and this is what I call preventive health, we will be hit very, very badly in the third phase also. And let me tell you, having interacted with majority of the doctors all over Maharashtra and all over India also, today the medical community and the frontline workers, when I say frontline, I mean the nursing staff, the sanitation, the ward boys, everybody, they are at the limits of their, work thing is concerned, management is concerned. And I hope that we are not hit by the third wave very badly, where it will tip over on the other side. And let me tell you, and this I have been telling the government entities also, tomorrow, if the health workers and the frontline workers take a back foot, if you don't treat them properly and they take a back foot, you will not have this army which today is standing between you and the pandemic or the virus. So I think they should also improve. The citizens should also improve. They should learn from how badly we were hit by the second wave. And if they don't improve, unfortunately, I am seeing everywhere in the marketplace, I am seeing in the hotels, again, the rush, the crowd, people are becoming a little complacent. I hope they don't do that, because how long is even the medical fraternity going to fight for you when you don't want to fight for yourself? It is impossible that we go on fighting for you when you don't want to fight for that. And I hope, I think you have opened this up, your webinar, to everybody. It is not only to the medical fraternity. I hope the word goes around to these people also, that if you want us to go on fighting for you, you have to do your bit also as far as the preventive aspect is concerned, so that we as a medical fraternity, as you know, in India, the percentage of people who are as compared to the population is very less, so that we can continue giving you the best, to the best of our ability we can give you. If you are going to help yourself, we are going to go on continuing helping you. So I think, Rajeshri, congratulations to you for having kept, Gadgil sir's whatever to the medical fraternity he was doing in the past, that you have continued doing that, and especially the word you have given, Wisdom and Excellence Award. Today, all of them have spoken about wisdom, what is the future going to be, and what their plans are. And they have been excellent people whom you have chosen, and they deserve all these awards. Maybe some of them who deserved it were not there because of purely paucity of time. As I said, if you start awarding everybody who have worked during this pandemic, that would take at least a month of such webinars to be held, because a lot of our colleagues and a lot of our frontline workers and healthcare workers have worked to control this pandemic. And that is the reason why, as I have said in the morning, that in India, though the numbers were huge, even if you see the percentage wise, definitely we have done much better than the Western countries, who have got a much higher budget, a much higher infrastructure as far as health is concerned. And that has been possible purely because of the healthcare workers in India. So thank you very much for having appreciated all our colleagues for the work that they've done in the pandemic. And may we go on appreciating the work that all of them have done. Thank you for inviting me today. It was my pleasure over here to interact with all my friends and colleagues all over who have come over there. Thank you.
Very well said, sir. Very well said.
And Rajeshri, we are just the representatives of each and every COVID warrior. So let me be very honest, and as I'm well and truly humbled and absolutely convinced about what Dr. Shri has said, we just are mere representatives of our fraternity. And with this, I would like to say a few lines for Shiv, if he allows me to do that. That जो मंजिलों के पानी की चाहत रखते हैं, with the leaders like Shiv, जो मंजिलों को पाने की चाहत रखते हैं, वो तो समुंदर पे भी पत्थरों से पुल बना लिया करते हैं. हजारों मिठाइयाँ चखी है जमाने में सर, खुशी के आंसू से मीठा कोई नहीं होता. Thank you very much.
Fantastic. Wow, kya baat hai.
Well, I don't want to actually say anything after that, but I definitely want to thank all of you here. And from the bottom of my heart, I want to thank Dr. Shiv Kumar Uture sir to be with us for the entire program today. This absolutely means a lot to me. Also, I want to thank Dr. Rekha Bhatkande madam to be with us. I don't know, you said people, Dr. Tivaskar should be a surgeon, but you both are surgeons, Dr. Bhatkande and you. So what is it about surgeons? You know, you all are meticulous, you all are warm, and on top, you're great teachers. You know, I think that is something great. I would want to make mention of only one person today, and that is Dr. Shikhande, Dr. V.N. Shikhande. He has actually been a part of all my programs when they were physically arranged. And valedictory koni karaichi, so it has to be him. It can't be anyone else. So today we would have, we
Today
didn't know
we
what
are
to do.
blessed to have Shiv,
Yes,
to have our world
yes,
valedictory, because who better person? Because
who
she was
better?
the first person, in fact, to, I don't know how many of you are aware about it, but Maharashtra Medical Council was the first one to even approve the credit points for the eCMEs and e-webinars
Yes.
during this COVID times.
True.
So, and that was another feather in, already a beautifully garlanded cap of Shiv. So I can say that very proudly.
So I'm indebted with your presence, Dr. Uture sir. And I know I can't repay that in any way for whatever you've been doing for the fraternity, for the patients. And, that's why it was your honor to be with us as the guest of honor as we began this award. So, thank you very much. And I'm sure we will be able to do work with you so that we can do great work for the fraternity. And that's a promise from me and TRUWELLTH, of course. On this note, I think we will have to end this program, though we don't want this session to end. The evening session is going to be the session which we normally do every year of purely wisdom and excellence stalwarts. And you all, of course, know that we have Dr. D.N. Reddy, Dr. V. Mohan, Dr. Shailesh Shikhande, Dr. Bhumkar. So, the list is endless. We have some international faculty with us also. So it's just absolute pride to be there. If you all get a chance, please watch through the same. And audience, we will want you to be with us. And we thank you for being with us through this entire program. On that note, I want to just pay a small promo of my of ENERGYA, because the team has relentlessly been doing work through 250 and plus seminars the last whole year, and they have done it's all I would say priceless work. There's no commercial gain there, but they've relentlessly kept spreading the awareness. So I'll just play their promo and we'll end the show, and I will of course connect with all of you again. Thank you very much, all of you.
Thank you very much. Stay happy, stay healthy, keep smiling, and keep on doing good work, Rajesh. Thank you very much.
Thank you. Bye-bye.